Hello, my name is Elizabeth Brown. I'm the Program Director for the International Board of Safety Professionals. And today we will be covering the Certified Occupational Health and Safety Manager course. To dive right in, there are core elements of the health and safety and environmental program. Those start with two key elements: management leadership, which is from the top down to the workers, and then that is going to work together with worker participation. So to have a very healthy occupational health and safety program, we must have both of these elements working together. So top management will demonstrate their commitment to a safe workplace by helping to eliminate hazards and constantly looking to improve workplace safety and health, as well as communicating that commitment to all employees and delegating the different elements of the program and different responsibilities, because worker safety and health is the responsibility of management of a company, but it should also be a responsibility for the workers as well. Workers are going to participate in the program by helping to identify hazards in their workplace, understanding their responsibility to report these hazards. They will also help investigate any incidents, help with accident and illness reporting. And when we're talking about worker participation, we're talking about not just our direct hire workers, but this applies to anyone working on our job site or at our company. That could include contractors or temporary workers who may be only working for a short period of time. Everyone must understand their roles and carry out their roles effectively to ensure the safety of everyone. Workers are encouraged to communicate to their supervisors and to other members of the safety management team to report any safety and health hazards, suggest improvements, and to be able to do this without any fear of retaliation, which we'll get into more as we get into the course. But we want to ensure that workers feel psychologically safe and physically safe. So psychological safety, meaning they feel safe to be able to identify hazards, report them, and ask for corrections from the management without fear of being demoted or maybe even having their employment terminated. Any potential barriers or obstacles to worker participation should also be removed. Suggesting that there is a reason that a worker might not want to report a safety hazard. In the past, some companies have had incentive programs where workers were actually de-incentivized to report safety or health hazards. And ultimately, it was because the company wanted to demonstrate they had a very good safety record, but this would discourage employees from reporting an injury or a hazard. And so these things are discouraged. Okay, another set of core elements of recommended practices for our health and safety and environmental programs in construction and for general industry, really for all workplaces, are having hazard identification and assessment procedures in place. So having procedures that allow workers and management to continually identify workplace hazards and evaluate risk that may occur, having safety and health hazards, being able to assess these not just for our routine daily activities, but also in non-routine situations like a maintenance or shutdown period, And also we have to identify what hazards might exist in emergency situations and be able to control these effectively. Additionally, we want to have had an initial assessment of existing hazards and exposures, and then identify control measures for these hazards and exposures. After the initial assessment, we want to have a scheduled periodic inspection schedule and reassess these hazards and the controls that we've put into place to ensure that they're still effective. The reassessment also allows for us to identify any new hazards that may exist. Any incidents must also be investigated to identify the root cause of the incident. In a very healthy safety and health and environmental program, we also want to be investigating any near miss incidents where an accident was nearly missed. So, there was no property damage, there was no physical ailment that occurred, but it could have, it was a very near miss. And so we need to identify the root cause of that near miss occurring to prevent any future accident or incident from happening. We also would identify hazards and prioritize the hazard control. We can do that using a risk probability matrix because when we do risk assessments, I always say that you can't just wave a magic wand and all of the hazards are controlled or go away just because we identified them. We have to prioritize hazard controls, of course, focusing on the hazards that are going to have a very high probability and the severity of the outcome if that hazard were to occur. Is very, very severe, could lead to severe injury or death. With our hazard prevention and control, employers and workers are going to work together to identify and select methods for eliminating, preventing, and controlling workplace hazards. We'll use the hierarchy of hazard controls to do this, which first we would ideally eliminate the hazard. If elimination is not possible, then we'll move on to engineering controls. Then followed by that, if all the hazard is not controlled or not able to be controlled using an engineering control method like a guard, then we will have safe work practices in place. We could use administrative controls. And our last level of hazard control is personal protective equipment, or PPE. We'll talk more in the course about this hierarchy of hazard controls and the reason why the use of PPE is a last resort. But ultimately, we want to eliminate hazards and control them using the engineering controls as discussed to, which will give us the highest level of protection. We'll also develop a plan that ensures that the controls are implemented, and if an interim protection is needed, we're going to track that progress and the effectiveness of the controls are verified. And that can be done through, daily observation, employee feedback, and then back to the first point on the slide, reassessing our hazards through periodic inspections to ensure that those hazard controls have been effective. When we mention interim protections are provided, a good example of this is if we identify that there is a need for respiratory protection, OSHA and all the international safety and health standards are going to want the company to install some type of engineering control, like a ventilation system, rather than having employees have to wear respiratory protection as a personal protective equipment on a daily basis. But having a ventilation system engineered and installed can take quite a bit of time. also takes quite a bit of money. So OSHA does allow that we place employees in respirators as an interim protection while that process is occurring of installing the proper ventilation system. So ultimately, they don't want to see it, respiratory protection, as our final solution for in respiratory protection, but they do allow that we use it as an interim protection. Okay, other core elements of our health, safety, and environment programs are education and training. So once we've identified the hazards and developed hazard control methods, we must train workers on those appropriate control methods. So whether it's engineering controls, administrative controls, work practices, or procedures, or even the use of personal protective equipment, we must train employees on those controls and what their responsibilities are with how to utilize these controls. All employees, managers, supervisors, and employers should receive training on general safety concepts, hazards, and their responsibility for protecting worker rights and how to appropriately respond to worker reports of injury, as well as reporting reports of accidents. All workers are trained to recognize workplace hazards and understand the control methods that have been prescribed and have been implemented. And they need to understand how to properly adhere to the rules and utilize the control methods. Our program will be evaluated and improved on a periodic and scheduled inspection to evaluate the effectiveness of the control measures. Effective programs should have processes established to monitor program performance, verify that the program implementation recommendations have been implemented properly, and identify any program shortcomings and recommend opportunities for improvement. Necessary action should be taken to improve the program and overall safety and health performance. Again, this should be done on a scheduled basis and annually at a minimum, but a lot of effective programs will have this periodic inspection on a monthly or quarterly basis. Communication and coordination for employers on multi-employer work sites. So we mentioned earlier, when we talk about employee responsibility, we're not just talking about direct hire employees, but also any type of contractor on site, any employee that might be hired through a staffing agency, as well as any temporary employees. These are all considered the company's employees in terms of a company's responsibility for these workers' safety and health. In the United States, we have workmen's compensation laws that have different rules related to who is responsible for providing insurance for a contracted employee or an employee that's been hired through a staffing agency. If they were injured, the contracting company and the staffing agency would provide the insurance and handle the payment for that injury, but that is different than the actual company's responsibility for those workers' safety. So just as if these employees are direct hired, a company's management must have established ways to communicate the safety and health hazards on the site, what the safety and health protections are, and how a contractor or any staffing agency employee is expected to control those hazards. This can be a coordinated effort, but it needs to be very clearly written and communicated with these different companies. What I mean by coordinated effort, it could be that the company or the employer and then a contractor have an agreement that the contractor has their own written set of control of hazardous energy sources rules or lockout tagout rules or procedures that they use. Perhaps they're electrical contractor and they're very well versed in that safety and health standard and have their own set of procedures that are as effective or more effective than the employer's procedures. Then the employer and contractor will have that written in an agreement that the contractor and their employees will follow their procedures when on site. So that's just one example. Another example would be related to who is going to provide safety and health training for the contractors and the staffing agency employees. What I've seen as a best practice is that typically the contractor is providing the safety and health training because they have very specific set of hazards that their employees are being exposed to. If they are just more of a general employee, then I've also seen where the company will provide something like an OSHA 10-hour course, or they'll provide training to the contractors. But it is acceptable for the general contractor to provide training to their employees, but then they would be required to provide these records to the hiring company so that the hiring company ensures that this training is being conducted properly. Another best practice I've seen though in terms of employees that are being hired through staffing agencies, I've seen a lot of times where staffing agencies do a good job of providing general worker health and safety training, but the employees, whether contracted or hired through the staffing agency, still must be provided specific on-site training for the specific hazards that exist at that work site. It's specifically with our emergency action plan and any other site-specific details. Those must be conducted prior to the worker working on that site. So any company should have a HSE policy or a health, safety, and environment policy. This is a formal statement or declaration that's issued by the organization's top management. So the president or the CEO, whoever the top management might be. This outlines the company's commitment to ensuring the health and safety and environmental protection of employees, contractors, visitors, and the environment and the surrounding community. The HSE policy serves as a foundational document that guides the organization in its approach to managing health, safety, and environmental risk within its operations. In this statement, we should identify what the staff involvement and empowerment at all organizational levels is. And a lot of times this is written in terms of that every employee on site has the capability to stop work if they identify that there is an unsafe action or unsafe condition that has occurred. It also would include the monitoring of customers' confidence and suppliers' compliance, laws, regulations, standards, and other requirements that the company complies with, how risk analysis and risk prevention are conducted, and then always include, because we are always striving for continuous improvement and performance, cost reduction, quality, and worker safety and health, and so workers' life. Regulations that apply to health and safety are many. There's many regulations throughout the world. OSHA, or the Occupational Safety and Health Administration, is the agency that regulates worker safety and health in the United States. A lot of the rules that apply in the United States also apply to a lot of work in specific industries. So, and with the OSHA standards, we have, they're divided in categories. There's the construction set of standards that are specific to the construction industry. We also have just a very kind of general industry set of standards that apply to manufacturing settings and a large group of businesses that fall outside of construction, maritime, or mining. So it covers like all other businesses. And in these standards, we have what we call horizontal standards and vertical standards. Horizontal standards are things that across the board cover and could apply to any company or any industry or operation. And then we have vertical standards where it might just be related to a certain substance or a certain type of operation, like power generation and distribution has its own set of standards. If a company does not participate in power generation and distribution, then they can disregard those standards and they don't apply to them. They don't have to have a written safety and health program or consider those hazards because it's just not in their scope of work. However, if they are exposing employees to silica, then they must be aware of and have a written safety and health policy and follow that regulation for silica in the OSHA standards. So there's just a few examples of how these regulations apply to the health and safety of our workers. Okay, legislation. So this is a rule or directive made and maintained by an authority. And so in many countries, I'll continue to use the United States as an example, the Occupational Safety and Health Administration has regulations that are enacted through legislation, which means that anything written in what we call an OSHA regulation is law. And so it has been enacted just like any other law in our country. And there are penalties and that will be given for a company that does not follow those laws. All right, then we have standards. So these are published and specific that give us a common language and technical specifications using precise criteria that's designed to be used consistently. As you can see here, we have this organization, the International Organization for Standardization. So these are designed to standardize not laws, but they're giving us rules or guidelines and definitions that throughout the world we're able to use to ensure that we're all working towards a standard set of materials, products, methods, that we're all speaking the same language in a way. This helps to make life simpler, increases reliability and effectiveness of goods and services that are sold throughout the world. Standards are designed for voluntary use, where regulations are required, right? They're a legal law requirement where standards are voluntary. However, companies that strive to obtain an ISO certification for a specific area can ensure that they have compliance with these accepted standards throughout the world. So when we comply with an ISO standard, we can assume that a company is conforming to what we consider kind of a gold standard of whatever that particular area of maybe the material or the good that they produce or the services that are being supplied. And we have ISO standards that apply and help us with setting up an effective health, safety, and environmental management system. The first one that I like to talk about is one that many, especially manufacturing organizations construction companies seek to obtain and uphold, and that's the ISO 9001 certification. Any company, no matter its type and no matter its size, can apply for an ISO 9001 certification. And this standard is specifically related to quality, is kind of what we're looking at here. It helps companies standardize their documents. You're using a document control system. It helps us improve business operations by ensuring that customers are consistently receiving high quality products and services by a company adhering to this ISO 9001 standard. It's probably the most common standard that I've seen companies apply for is that ISO 9001. Another ISO certification is 14001, and this is a tool for organizations to use to ensure their environmental performance complies with all applicable legislation. There's a company called Compliance Quest that helps companies identify, analyze, monitor, and mitigate the existing and potential hazards and risks by capturing and reporting environmental audits and incidents anywhere, anytime. So there's tools like that that can help companies comply with these ISO standards, and it also helps you apply for and obtain initial certification. And then there is a continued compliance that must be obtained. And then you'll also be audited for any of these ISO certifications. You would be you're voluntarily being audited by a third-party ISO auditor, where they come in and will review any of your documents that relate to whatever the ISO certification that you're applying for or applying to renew. And they review those things. They have their own set of audit tools and checklists. And so using something like Compliance Quest kind of helps you capture and report all those audits and forms that you need to do to comply with this program. And then another more recent ISO standard is the OSHA 18001, and that was the Occupational Health and Safety tool for workplace safety and health. And then now that's been merged into the new version, which is the 45001. This is designed to allow organizations to adapt their work health and safety management systems to work efficiently. I've helped quite a few companies develop their programs to adhere with the ISO 45001. And it does, once you've gone through all of the elements of this standardized program, it really does help create a very comprehensive health and safety management system. It also helps companies automate electronic reporting and their OSHA incident reporting. And one of the great benefits I see to the ISO 45001 is just the systemized hazard and risk assessments, as well as hazard controls and just really helps you have a comprehensive understanding of what those are in the workplace. It also requires that you have those periodic inspections and review those controls for their effectiveness, and that we're ensuring that we're doing this as a team and including all stakeholders, from the kind of newest worker on the floor or on the site to the highest level of management. They're all working and having input in the system and working together to continuously improve workplace safety and health. All right, some important elements of the ISO 45001 It provides an internationally recognized framework for managing occupational health and safety risk. It enables organizations to systematically assess hazards and implement risk control measures, as we mentioned on the last slide, which ultimately will lead to reduced workplace injuries, illnesses, and incidents. We're constantly improving that and trying to strive for zero injuries, illnesses, and incidents. Adopting this ISO 45001 standard demonstrates to employees and your external stakeholders, so possibly customers, public image, that this organization is committed to worker health, safety, and well-being. So this can boost a company's reputation. It can definitely increase employee morale and increase employee retention, which can be very key in just overall positive culture within the company. Some more importance of the ISO 45001 from the International Organization of Standardization themselves demonstrates that the standard requires complying with the occupational health and safety regulations. So by complying with the ISO 45001, you'll also be ensuring legal conformity. It also promotes proactive risk management, potentially can lower your insurance premiums, and by requiring emergency preparedness and response protocols, ISO 45001 strengthens organizational resilience against safety threats and crises. So by really having a strong focus on the emergency preparedness and planning, by conducting drills and practice exercises for any emergency response, that company would be much better prepared than someone that has not complied with this to act in a situation where there is an emergency. A common thing we see in ISO 45001 is this framework of plan, do, check, act, which means that the occupational health and safety system is using this continuous improvement cycle of plan, do, check, act. And as you see there, this is something that there's no stop sign in the middle of it. There's no finish line. Once we get to the act part of that framework, it's circular. We're starting back over. And when we talked about doing periodic inspections and having continuous improvement, this is a great framework to use and to consider that we will use. So we plan something, we do it, we check to make sure it's working, we act to control the hazard differently if it's not. If we identify a new hazard, we start back over and we plan to check, act again. So this utilizing this framework helps us to continuously improve, which will enhance over the long-term worker health and safety performance. So just a little bit more about this continuous improvement model plan. So we're identifying opportunities for improvement and creating a plan of action. We're going to implement the plan on a small scale. And then we'll check, we'll measure using data to determine if the plan was effective. We can get feedback from workers. There's a lot of ways to check to see, did our plan work? And then based on that data and feedback, we'll either implement that change on a larger scale, or we will cycle back to the previous step if the desired results were not achieved. ISO 45001 has 10 clauses that fit into the plan, do, check, act methodology. We have scope, normative reference, terms and definitions, context of an organization, leadership, planning, support, operation, performance evaluation, and continual improvement. Another kind of look at how the plan, do, check, act framework works in the context of an organization. In our planning stage, we identify internal and external issues. And that is a part of then in the ISO 45001, our support and operation clauses. Then when we go to the do element of the framework, we're looking at performance evaluation. And between planning and doing, right? Planning and a performance evaluation, we have leadership and worker participation. Those are those elements that must work together. We have to have leadership from upper management to drive these programs, and then we have to have worker participation for effective programs to be implemented. So through the performance evaluation and through that feedback cycle, we're working towards these intended outcomes of our occupational health and safety management system, which is to constantly be improving our health and safety program on site at all times. We're also, when we're looking at planning, we're also looking at the needs and expectations of workers and other interested parties. So as you can see, this is something that new issues can arise at any time. We're listening to worker feedback, whether it be through an accident report, a near miss, or a hazard identification. We're taking that into account. And it's always positive to not just take in what is the hazard the workers identified, but asking for their input on hazard controls, because there's really no one that knows their job better than the person doing it. So I always recommend involving the operator or the worker whose job is affected by the hazard or the control that might be being considered to be implemented, because they're going to be the ones that can give the feedback of whether they think it would be effective. In terms of, we have to always be looking at the trade-off between effective hazard controls and production, right? If we can have a worker fully protected from all hazards at all times, they may not be able to actually do their job at all or do it very productively or quickly. So we have to find a trade-off between those two things. All right, so we want to look at what are the benefits of having an occupational health and safety management system. We talked a lot about, obviously, decreasing accidents and injuries and increasing employee morale. But having an actual written occupational health and safety management system provides us a systematic way to ensure that we are considering all health and safety hazards and risk on site and controlling them. And so by doing that, we're going to improve the health and safety performance overall for the company. We're going to reduce associated costs associated with accidents and incidents, whether it be property damage or costs from an employee injury. We're going to improve employee morale and improve staff relations, improve business efficiency. Again, there's a trade-off between controlling hazards and productivity. But if we have healthy workers that are happy to be there and they're not injured, so they're not missing work, then overall our productivity and efficiency is going to be much higher. We also can improve our public image of the company and improve personal or public relations. We'll lower our insurance premiums, which could lead to better creditworthiness for the company, so easier access to finance. We've increased our regulatory compliance, and honestly, through ISO 45001, generally surpasses the requirements that a lot of the federal laws or legislation requires. It can improve confidence for everyone involved, improves like the culture overall and can boost corporate and social responsibility. So I hope you see the need here and the importance of having a written and documented occupational health and safety management system, and utilizing something like ISO 45001 as a framework to do so. Like we just talked about, there's so much positives to having an occupational health and management system. The benefits continue to be improved health and safety performance. And there's no doubt that adopting this systematic approach and using a specific system will make managing your business easier, and allows that we're putting proper systems in place. Takes a lot of the guesswork out of, am I, as a manager or high level executive in a company, am I doing the right things? Am I making sure that all of the health and safety hazards are being controlled? This, putting a system in place like this that's specific, ensures that we're considering all of the elements of and hazards that could exist, and that we're able to control those effectively. And when every worker is clear about the precise protocols that they're expected to follow, and everyone uses the same approach every time through this standardized system, then your organization's occupational health and safety performance will improve overall as well. All right, some more benefits of an occupational health and safety management system. We have reduced costs associated with accidents and incidents. And we're looking at costs associated with accidents and incidents. If your organization does not currently have an occupational health and safety management system in place, you may be painfully aware of how expensive correcting mistakes and problems can be. Every time an accident occurs, we have direct costs that might occur, things like staff compensation claims. If we have an accident, that can push up our insurance premiums. I've seen incident or cases where companies were facing not having their insurance renewed because of a high level of accidents that we needed to address. Also, when we have workers that are injured, we still need to produce the goods that we're making or construct the buildings that we're constructing. And so we may have to hire temporary staff to go into the place of the worker that was injured. Or sometimes companies don't do that, and they're not able to reach their production goals or make theirs scheduled on time. So this can really be considered, some indirect costs too. You may lose potential business because of this. A third benefit of our occupational safety, health and safety management system is that having an effective one in place is proven to increase employee satisfaction and helps improve staff relations and morale. I've worked with companies on kind of both ends of the spectrum in terms of having a really effective OHS management system in place, and those that do not have one implemented yet, that I might be working with them to create this program from the beginning. And there is definitely a big difference in the staff relations and the employee morale. And what I like to look at is like the overall culture within the company. There's been companies I've gone to work with that I didn't even really want to be there because everyone just kind of had a negative attitude, because they didn't, ultimately feel valued by the management. They were, working in relatively unsafe work conditions. And so they, didn't feel valued. They didn't feel like it was safe to be at work. So their safety culture was very negative, and just their overall culture within the company was very negative. But when we have a solid and healthy safety culture that's thriving, that says to employees that my manager in this company cares about me as a human being. They care about me, that they're taking care of me. You know, they're ensuring that I go home to my family each and every day in the same way I came to work, and am able to provide, you know, a good wage and provide for my family, and to do so without, you know, physical harm. That really speaks volumes in terms of employee satisfaction and happiness and employee retention. So, what other benefits do we have with an OHS management system? So we can improve business efficiency. So implementing an OHS management system is one of the best ways to improve the efficiency of your business, because it does reduce your costs. Oops, sorry. It does reduce your costs almost across the board. An OHS management system can just help you increase that business efficiency by following this systematic way of implementing the strategies like suggested by the ISO 45001. Oops. Okay. An additional benefit is improved public image and public relations. So, yeah, there's, I think we've all heard of the phrase, there's no such thing as bad publicity. But for anyone who coined that phrase or has said that phrase, that might be true for maybe, you know, I've heard it with like actors or, you know, people in the spotlight. But it is certainly not true for public relations for a multinational company. There is absolutely a thing as bad publicity. Having serious health-related accidents and injuries do become public and can cause irreparable harm to a company's public image. Consumers are far less likely to trust companies that don't take their employees' health and safety seriously. And now in this day and age where there is so much communication online, on TV, on social media, it's very easy for the public's trust to be lost and for a company's reputation to be tarnished just through perhaps one event occurring, and or even having an employee that is unhappy at work and goes to the press and, you know, reports about this. These things can spread very quickly with things that we have these days, such as social media. In the United States, with OSHA's injury and illness reporting, there are requirements, that online reporting requirements, where there's a database of injuries that occur at a company that are public. So if someone were to, you know, and it doesn't necessarily have employees' names on these documents, but you can see what are the injury rates and what injuries are occurring at specific companies. Public image can also be tarnished through, you know, environmental accident occurring. Those types of records are also public and can be searched by interested parties. And if that, you know, reports, I've seen reports of contamination or, you know, different things can get out there. Through an interested party, maybe a river keeper, for example, then that gets spread on social media very quickly. So these are all, you know, very important things to consider. We also have things like lower insurance premiums. When most businesses start considering a formal OHS management system, one of their first considerations is the cost. So while there is certainly a cost to do this, because we have to commit, you know, people to develop these programs, it does take quite a bit of time to do this. A lot of companies consider hiring an outside party, like a consultant, to help guide the implementation of an OHS management system. So there are a lot of costs, but we have to consider the cost savings as a part of the equation as well. So we've already talked about, decreased costs to the company with lower accident rates, and that will directly impact your insurance premiums as well. So you can consider having lowered costs with lower insurance premiums. Also, just maybe some more indirect cost savings are reducing employee turnover. If I've worked with companies that have quantified the cost of hiring a new employee, and there is quite a cost with having high employee turnover, because there is a cost related to hiring a new employee. There has to be promotion of a job opening. You have a human resources manager or someone that is having to interview and do background checks, and a lot of companies do drug testing, so there's all types of pre-employment costs or requirements that must occur when we hire a new employee. So lowering our temporary workers hiring as well. There's training costs associated with the new employee, and then driving down the cost of accident investigations and incidents. If we have an accident, we have to have employees, our safety manager and other safety related staff that are involved, our managers, supervisors, involved in investigating the accidents and working together as a team to recommend controls so that accident doesn't happen again. Another huge cost can be, or huge benefit, can be increased regulatory compliance. So this statement is very true. If there are two words that strike fear into the heart of most business owners, then the two may be regulatory compliance. In companies I've worked with, something that strikes fear is just OSHA is here. Regulations have continued to increase, and punishments continue to get even ever fiercer. And in the United States, those punishments include, high levels of monetary punishment. So probably 7 to 10 years ago, a serious citation for a serious violation of the OSHA regulations would have resulted in up to a $15,000 penalty. And now those numbers can be upwards of $130,000. So the increase in potential monetary punishment and penalties has gotten higher and higher just in the past 5 to 10 years. Another example is the WHS Act in Australia requires businesses to immediately notify their regulatory body whenever a notifiable incident occurs, such as death, serious accident, or injury. In the United States, the OSHA requirement is if you have one person that gets admitted to the hospital, you must notify OSHA by calling them and directly reporting that incident within 24 hours. If you have a death, you have to report it within 8 hours. And the majority of the time when that was reported, death or serious accident or injury, then OSHA is going to conduct a workplace inspection to see what was the cause of this occurring and to ensure that there are controls in place so it doesn't occur again. But typically when a regulatory agency like OSHA is on site, that leads to an opportunity for citations and penalties to occur. When OSHA, for example, is on site and conducting an inspection, they're always going to ask to see some type of written policy related to whatever the accident or incident that occurred. So having an OHS management system will check that box, or will tell OSHA that we have an effective system in place, but we've done our due diligence, but this one-time incident occurred. It could be due to an employee not following established rules in place. Having that system in place is key to demonstrating that you have an effective program, and does help to mitigate those citations and penalties. If you don't have a OHS management system in place, the chances of unknowingly committing an offense are quite high, whether it's due to negligence of management, human error, whatever the case may be. There's just so many things we have to consider in our occupational health, safety, and environmental program that is really quite difficult to do without some type of systematic way to do this. We have improved confidence too as a benefit of an OHS management system. It helps to ensure that your staff members are more protected from a wide range of threats and health problems. So they feel more confident in their managers and the company. They feel confident that they're being protected, and then the management can feel confident that they have conducted a comprehensive review of all of the health and safety hazards that could exist, like falls, injuries, repetitive strain injuries, effects of vibration and noise, skin diseases, asbestos-related diseases, and that's just a very short list of the things that you might need to consider when you are developing and implementing an OHS management system. Other benefits of OHS management system include boosting corporate and social responsibility. I mean, if we all just acted in a way that the high level of morality, that, that we care about others and the people that work for us and with us, then we would not rely on harmful labor practices, and we would ensure the physical, social, and mental well-being of our employees. So having a strong OHS management system in place is especially important to ensure we're upholding these ideals, and also building your company's brand appeal. There's always lists of the top 100 best places to work in a country or in the world, or safest places to work. There's awards that are given out. So this is obviously something that's very important to the public overall and to each individual. So an OHS management system shows that the company values all aspects of all of the employees that work for them. Excuse me. All right, we've talked a little bit about health and safety culture, but let's kind of dive into that a little bit more. This is something I'm very passionate about. While we look at health and safety typically as guidelines and procedures that are in place that support the welfare of individuals, the health and safety culture itself surrounds and is like the mindset of the group of people that are related to this. So in short, the health and safety culture in a workplace involves what employees both believe and perceive health and safety to be, which ultimately contributes to how they act in the workplace in line with the guidelines and practices that the management of the workplace have prescribed. When there's a positive health and safety culture, employees are more inclined to behave in line with the health and safety guidelines. But if there is a negative health and safety culture, employees are less inclined to behave in line with those health and safety guidelines, and which leads to employers increasing their risk of encountering more work-related accidents and illnesses. because we have, human beings involved in this, and we can't control what everyone does every moment of the day. But if we have a healthy health and safety culture, then this is an environment that employees come to work in where they are encouraged to demonstrate positive health and safety practices, and which means they're more likely to follow the procedures and policies and adopt the hazard controls that they should to help them minimize work-related accidents and illnesses, which also will ultimately prevent worker absences due to accidents and illnesses. According to HSE, there are 6 main benefits of a positive health and safety culture at work. So we've talked about reducing workplace injuries and accidents, which will then in turn decrease worker absences, which would then in turn increase employee productivity. It accelerates our safety culture improvement. It gives you a competitive advantage as a business leader. It helps improve your organization's reputation, increasing public relations, and provides typically for better staff retention and a boosted workplace morale. Like I've said earlier and say a lot, a healthy worker is a happy worker and is typically a worker that's at work. So if I can come to work and my body doesn't hurt, it's a somewhat enjoyable environment to be in. I enjoy the attitudes of my fellow workers, then I'm happy to be there and I'm going to be a more productive worker. All right, let's switch gears a little bit and look at some safety fundamentals. And what do we mean by safety fundamentals? We refer to safety fundamentals as basic principles and practices that form the foundation of a comprehensive safety management system. So some of our key safety fundamentals are going to include risk assessment. So through conducting risk assessments, we're going to identify potential hazards and assess the likelihood and severity of associated risk. This can include the impact of physical hazards and risk, chemical, biological, ergonomic, and psychosocial factors on the safety of our workers. So really looking at a comprehensive list of hazards and risks that can affect workers. Hazard identification is also a safety fundamental where we are regularly identifying and documenting potential hazards in the environment. This involves recognizing unsafe conditions, potential substances we might be exposed to, or unsafe actions that have the potential to cause a worker harm. I encourage companies to have a hazard identification reporting system that allows employees to easily report things they might consider to be hazards, and also suggest hazard controls that they might think might be effective. Now, they might not have the same level of training as a certified health and safety manager, but having employees that are open to reporting hazards is a great step in the right direction of having a positive health and safety culture. Other safety fundamentals include personal protective equipment, so providing and mandating the use of appropriate personal protective equipment based on identified hazards. Some items that are considered personal protective equipment include safety helmets or hard hats, gloves, goggles, respiratory protection, and other protective gear. And we talked about the use of personal protective equipment as a last resort of hazard control in the hierarchy of hazard control. But there are most workplaces do require some use of PPE. Additionally, we want to look at prevention of accidents and incidents as a safety fundamental. We're going to establish measures and protocols to prevent accidents and incidents. This includes implementing safety procedures, engineering controls, and administrative controls to minimize risk. And we'll dive into what each of those mean as we get into the course a little bit more. Another key element of safety fundamentals is emergency preparedness and response. So looking at emergency plans, and response procedures to handle unforeseen events. I'm going to mute myself for just a second. So having these emergency plans and response procedures to handle the unforeseen events. So not just our regular work routine, but what are we going to do if an emergency occurs? What are emergency situations? So understanding what potential emergency situations can occur, and having appropriate emergency response plans in place. So typical things in a workplace are going to include a fire and having the evacuation plans related to what type of emergency action are we going to provide in the event that a fire is to occur. Having first aid training for employees to be emergency responders to provide first aid, emergency response, medical care. This can include helping an employee that might have had a bad cut all the way to performing cardiopulmonary resuscitation or CPR, and also using an AED device if someone were in cardiac arrest. Also having coordination with emergency services, such as our local fire department or medical provider, having a plan in place for what hospital employees may be transported to if advanced medical care is needed. All of these things are what we're going to use when we're addressing our emergency preparedness and response. So training and education is a very important safety fundamental that we are going to utilize to ensure that all individuals involved in a particular area of our work operation, environment, or activity understands the safety procedures through having adequate training and education on those procedures. Depending on the regulation, there are different requirements on how often that training must occur, but almost all regulations require that the training occurs prior to the employee being exposed to a hazard. So say an employee is a new employee, they must have new hire training and be trained on all of the hazards that they could be exposed to in the job they're going to be performing, and understand the control methods in place and how to properly follow those control methods. So what is their responsibility in our safety program? Some examples of that might be they are trained on and understand what type of personal protective equipment they're required to wear, and when are they required to wear it. Other examples might be training on the emergency response plan and what their role is in that. But a lot of our standards and regulations do require that employee training and education occurs, again, prior to the employee being exposed to the hazard, but then also on some periodic basis. Typically at a minimum annually, we would be retraining employees on these topics. All right, communication is a huge safety fundamental. We've talked about the importance of having management leadership and employee participation, and how these are complementary elements that work together hand in hand. So we must have established clear lines of communication from our managers as our leaders in effective ways that employees can understand. Meaning if we work for a multinational company and we have workers that have different native languages, that we're training employees and communicating in all languages that all employees can understand. Effective communication helps ensure that everyone is aware of potential risk and understands how to respond. We must also have effective communication channels between our workers to our managers. So again, having a psychologically safe environment where a worker does not fear reporting hazards or reporting concerns or an accident to their managers is also another important element of the safety fundamental of communication. Compliance with regulations and standards is another safety fundamental. And for a company, this is a law that we must comply with. So we have to adhere to relevant safety regulations and industry standards. Again, complying with and obtaining the ISO 45001 or 18001 or 9001, all of those things helps to ensure that a company is complying with all of the relevant regulations and industry standards. Compliance with the country's safety regulation standards typically means that the organization meets the minimum safety requirements and accountability requirements to provide a safe work environment. But there's no law that says you can't have a higher level of safety than what the law requires. In the United States, because the safety and health regulations are passed through legislation and our law, it can sometimes take many years for a regulation to be implemented or to be updated. And the outdated law that might be waiting to update may not be providing the highest level of worker protection. So there are different voluntary standards out there based on what the hazard might be. I can think of specifically some different health exposures. The OSHA regulations might have a lower acceptable exposure limit to a type of contaminant that we may breathe in. But there might be a voluntary agency that recommends a higher level or the employees are exposed to a lower level than what OSHA requires. And it's certainly within the companies and the managers' right to say that we as a company are going to comply with the voluntary standards and we're going to protect employees more than the law requires. Another safety fundamental that can help encourage a positive safety culture is something called behavior-based safety, and encourages a safety culture by promoting responsible and safe behaviors among all individuals, which involves fostering a mindset where safety is a collective responsibility, meaning everyone is actively contributing and responsible for maintaining a safe environment. And so through behavior-based safety, we see things like social factors, organizational factors, personal factors and choice, and job factors. And these behaviors that employees demonstrate can lead to safe actions and unsafe actions. So when we have safe actions, then we have positive consequences. And then when we have unsafe actions, we have negative consequences. So sometimes these can be a natural result of an action. And sometimes it's procedures and policies we have in place that positively reward an employee for demonstrating safe actions. And then in the same way, there's negative consequences like a discipline program where employees might receive discipline for demonstrating unsafe actions. We're always seeking continuous improvement, as we've talked about, as a safety fundamental. Implementing a system such as the framework of Plan, Do, Check, Act can help ensure that we're regularly reviewing and updating our safety policies and procedures, and we're doing this on a scheduled basis, or on some type of reactive basis based on an incident report, a near miss, or having it as a part of our change plan if we're having a change to the work environment in any way. Maybe we're changing the setup of our production line. Maybe we're changing a material or changing a process. When we do that, we need to ensure that we're considering all the safety factors and health factors that might exist as a result of this change. Housekeeping is quite a significant safety fundamental. You will see housekeeping referenced in many health and safety regulations and standards. But what this just generally means is that we have a way to ensure that our workplace is clean and organized, and doing so helps just by having an effective housekeeping system helps to reduce the risk of slips, trips, and falls in the workplace. It also can help to reduce risk of accidents related to material handling, like with forklifts, cranes, and manual material handling, having employees carry things themselves. And proper housekeeping will include having regular inspections, removal of obstacles, having areas where we have proper storage of materials. I think it's important with housekeeping that if we see an area where we consistently see maybe a lot of trash on the ground, consider, is there a trash can nearby? I've seen in workplaces where the trash was not being removed frequently enough. So we implemented, a schedule where workers had responsibilities to remove the trash on a scheduled basis, and this helped to improve their housekeeping in that area. Ensuring that cords and chains and things that could, tools that could be on the ground have proper storage areas, that we have the proper things, like even something as simple as a broom and dustpan where employees can clean up after themselves, as well as having time built into a worker's schedule where they are responsible for the work area and they have time at the end and beginning of their work shift to clean and organize. Really goes a long way to ensuring proper housekeeping. Having health and wellness programs is also a safety fundamental. This helps to promote health and wellness to prevent occupational illnesses and improve overall well-being. This can include programs such as physical fitness, mental health, stress management. I've seen companies have either challenges or healthy kind of competitions, or where employees could get prizes or rewards for how many steps they walked in a day. So they'd wear a pedometer on their wrist, or now a lot of people have smartwatches that track their heart rate and track how many steps they walk. So encouraging active employees, having employee assistance programs where mental health is valued and stress management practices are encouraged, encouraging employees to take breaks. If they're workers that work at a computer and are sitting a lot, encouraging that they have, standing breaks and stretching. I've seen stretching programs be a big part of improving worker health. At one company in particular, employees were having a lot of strains and sprains because they were going into work working the third shift. So, 11 p.m. at night to 7 or 8 a.m. in the morning. And a lot of workers were are just getting up out of bed and going straight to work. And it was a very high intense physical activity job. And they were going in, lifting heavy things very quickly after having just woken up. And that was resulting in a lot of sprains and strains. So we implemented a physical fitness program that at the beginning of each shift, the supervisors led a short session where they talked about their goals for the day, but all the workers went through a stretching routine while that kind of toolbox talk was occurring. So that really worked to help increase employee health and fitness there and reduce injuries. All right. Switching over to, why are we doing all of these things? Why are we focusing on identifying risk and hazards and controlling them, and having these health, safety, and environmental systems in place? And ultimately, it is to reduce or eliminate as many work-related injury and deaths as we can. According to the ILO, they estimate that 2.3 million women and men around the world succumb to work-related accidents or diseases every year. This corresponds to over 6,000 deaths every single day. So that is just, to me, completely unacceptable that over 6,000 people go to work every day and die because of a work-related accident, and they do not go home. They can't contribute to their family. So even more people are affected by this, huge number of worker deaths that are occurring. Additionally, outside of deaths worldwide, there are 340 million occupational accidents and 160 million victims of work-related illnesses annually. And these are just the things that are getting reported. We can assume that there's probably an even higher number of these accidents and illnesses that are occurring. So you can see on the table here the types of injuries and illnesses that people are being exposed to, with the highest percentage being musculoskeletal disorders. So strains, sprains, and fractures to our soft tissues like our muscles, ligaments, tendons, and then fractures of our skeletal structure, our bones. Our next highest to that actually is mental ill health. Then from there, we have cancers, respiratory issues, so toxic exposures that people are breathing in, and then just kind of a general injury that can occur. That could be anything from an amputation to a bad cut, there's all kinds of things that fall under just that injury category. Hearing loss, actually, this might be somewhat of a surprise, but hearing loss is considered what we call a recordable occupational injury or illness in the United States. But employees being exposed to dangerous noise levels will lead to hearing loss over time. And sometimes it can be acute exposure or one-time exposure that can lead to permanent hearing loss. Once hearing loss occurs, it can never be replaced. There's no procedure that has been discovered that can replace the auditory ability once it's been damaged. So it's very important that we consider our hearing conservation programs and our noise levels and ensure we're protecting employees from that. Right after hearing loss, we have heart disease that also is affecting employees. And then something like catastrophic harm is 1%. The International Labor Organization, or the ILO, we saw that estimates there's greater than 2.3 million fatalities every year due to occupational accidents and work-related diseases. And then more than 337 million workers sustain injuries, more than 160 million cases of work-related diseases. And as I mentioned on the last slide, that's just the accidents and illnesses that are being reported. So many accidents at work can go unreported. And most occupational diseases can go undiagnosed. So there is a gross underreporting. And the cost of all of this, the cost of these fatalities and injuries and illnesses is estimated to cost countries 4% of their gross domestic product. So that is, quite a bit to a country themselves. But as we talked at the last slide, the cost to the worker themselves and the family, we can't calculate that. For 6,000 workers to die each day and the families that are affected by it, we can't calculate what the cost of a life is, or of a loved one is. So this is truly, why I do what I do, to increase awareness and about worker safety and health, and the importance of having these systems in place, like the Occupational Health and Safety program that you could develop through ISO 45001. When we're looking at the causes of these deaths and injuries and illnesses, we can essentially boil them down to, or seek out the root cause for any incident that occurs. And we can divide those into unsafe acts and unsafe conditions. So unsafe acts are actions or behaviors that can lead to accidents or injuries. They're typically committed by individuals who fail to follow the safety rules. They might be taking a shortcut, or they're engaging in risky behavior. And it's estimated that 80% of all injuries on the job are a result of unsafe acts. Some examples of unsafe acts. This picture is a great example. We have a worker on the far right that it looks like is wearing appropriate foot protection. It's kind of blurred out. It's a little hard to see, but we definitely can tell that the worker wearing sandals that has his foot exposed is not performing a safe act. So this is a decision to not wear the personal protective equipment. We don't know the decision behind that. He might not own a pair of boots that he needs to wear, but the company should ensure that each employee has access to the personal protective equipment that they're required to wear to be safe. Speed is another unsafe act. So operating a machine at a speed that's not designed to run at. Working without authority. So entering a confined space before it's been declared safe is a very common unsafe act that can lead to very serious harm or death. Adjusting moving machinery, lubricating bearings, or changing drive belts while the machine's still running. I've personally been involved in an accident investigation where an employee was helping a maintenance worker change out a belt, and they had followed the proper lockout procedures, and they were just testing to make sure that the belt was on correctly. And the maintenance worker, who was very knowledgeable, was in the motor control room turning the machine back on and removing the lock, while the other employee was supposed to just be visually watching, is the belt on properly. He was not supposed to touch anything, but he thought the belt was off just a little bit. So while the machine was running, he decided to just kind of push the belt back on a little bit, and it ended up amputating. His hand got caught in the belt, and it ended up amputating all three of these fingers. So, very simple, quick actions that are unsafe and not thought out can lead to very terrible events. We also, in the last slide, we talked about unsafe acts and unsafe conditions. So again, 80% of the accidents that occur are due to unsafe acts, but we can have unsafe conditions. To me, unsafe conditions are easier for a health and safety manager to control because we can see these unsafe conditions and we can change the work environment in some way to make it safer. We can do these through hazard identification techniques such as job safety analysis or job hazard analysis. So JSA or JHA, it just depends on the company. Some they're interchangeable terms. They mean the same thing. It's a technique that involves breaking down a job into each task within the job and then identifying associated hazards by each task. So each step is analyzed for the potential risk that might occur, and then preventative measures or hazard controls are developed for each task and each risk associated with that task. This JSA or JHA is most effectively conducted using a team of people and also using checklists that are specific to the industry or the activity. And so going through each task and using the checklist to check off what hazards we observe, and by looking at the unsafe conditions in the workplace and observing a worker doing that job to identify the unsafe acts that might potentially occur. The checklists are very helpful to be used. They cover, all types of things that could affect the workplace safety and health. So things like our equipment, our procedures, environmental factors, and then of course, worker actions. So here's some examples of unsafe conditions. This picture is certainly unsafe condition, but also a worker engaging in a very unsafe act by standing on top of that rebar. That just makes me very nervous just seeing this picture. The unsafe condition refers to situations in the workplace that have the potential to cause harm or injury to the employee. Obviously, if this worker were to make one misstep, he could fall and be impaled or very seriously harmed by falling on or around that rebar. The study attributes 20% of all injuries on the job to unsafe working conditions. Because as you can see here, we can have unsafe working conditions, but it typically, that could be there, and certainly is a hazard to have this kind of open-sided, fall hazard with the rebar where it looks like maybe concrete's going to be poured, but it takes an unsafe act to then contribute to the accident occurring. Of course, there could just be someone kind of walking by on this open-sided area over to the right. They could trip or, something that contributes to, they were trying to be safe. They weren't trying to act in an unsafe way, but the conditions lead to their injury. But as you can see in the example here, there's unsafe conditions and unsafe acts occurring. So some unsafe conditions include poor guarding on machinery, so inadequate or inefficient, or as I've seen many times, completely missing machine guarding, which can typically be attributed to an unsafe act, meaning an employee removes a machine guard, for example, on a hand grinder because they excuse me, need to grind in a corner or an angle of something that they state that the guard keeps their the grinder from reaching that spot that they need to grind. And so the employee will remove the guard. So, that's an unsafe act. Having inadequate or inefficient guarding, that could be an unsafe condition. An employee might be using a piece of equipment and they're not aware of the guarding not being adequate or efficient. An example of that might be a piece of equipment that has a light curtain, some automated equipment that uses a light curtain that if the employee breaks the plane of the light curtain, the equipment is supposed to turn off. Those light curtains can have faults, just like any kind of safety device can have a fault in it. And so that could be an example of poor guarding or poor safety devices that could lead to unsafe conditions. Other defective conditions like hand tools, equipment being damaged, substances we're exposed to, having poor layout, having workflow issues, overcrowding, congestion. I've definitely seen that in workplaces where employees are just shoulder to shoulder working together, and it gets quite crowded, and and can lead to an unsafe condition where an employee might bump into another person, or something like that might happen. When we have loud noises, as well as or in particular, when we have loud noises and require employees to wear hearing protection, they might not be able to hear instructions, and they may not be able to hear a warning bell or siren that's instructing them that they need to evacuate, or they need to move to another location or shelter in place, whatever the case may be. So when we have loud noises that could prevent employees from hearing instructions, we need to have other ways like visual flashing lights or something like that that can get employees' attention. Inadequate illumination or ventilation. So I can't see clearly or I can't breathe properly. Those are definitely examples of unsafe conditions that need to be addressed. All right, let's look at what are the top 5 safety hazard types in the workplace. And this can help an occupational health and safety manager to be aware of these 5 safety hazard types and work towards analyzing them and then providing control measures. So first we have just the general safety hazards. Then we have physical hazards, biological hazards, chemical hazards, and ergonomic hazards. So we'll talk about each of these top 5 safety hazard types. So safety hazards are the most common workplace hazards. They'll occur in most workplaces at one point in time or another, especially in like utility industries, construction industries, or any kind of industry where employees are working with machinery. The machines can definitely make the job more productive and can allow a worker to do things that prevent other injuries, like manual lifting injuries are prevented by using a forklift. But they do have their own set of safety hazards that are inherent to their use. So we have to be aware of those and ensure protection for employees from these hazards. All right, so let's look at our physical hazards. Physical hazards are environmental hazards that can harm the body even without physical contact. So they affect those who work in extreme weather conditions or harmful environments that include moving equipment, poor housekeeping, like scattered materials on the ground, a slippery floor, trailing cable, an unsecured ladder, being exposed to excessive noise. Like we have this picture of a jackhammer and it's like a constant loud noise, being exposed to radiation, like ionizing and non-ionizing, EMFs and radio waves, even exposure to sun rays and ultraviolet rays like we get from like welding. These are all physical hazards that employees can be exposed to without really even physically coming into contact with it. But we can see that these physical hazards can be considered unsafe conditions and can be controlled by simply, for a lot of them, by simply having a good housekeeping practices in place. Biological hazards are caused by exposure to harmful substances associated with infectious plant materials, animals, or people. People working in hospitals, laboratories, zoos, schools, daycares, restaurants are the most vulnerable to biological hazards. These are hazards because employees are constantly exposed to things like blood and other potentially infectious bodily fluids, where we're concerned about exposure to bloodborne pathogens such as HIV and hepatitis B and C. We're also exposed to different types of bacteria, viruses, fungi, animal droppings, insect bites, and different types of plants. So all of these types of workers that have potential to be exposed to biological hazards, we must have, a different set of hazard assessment checklists that we're reviewing when we're looking at a comprehensive risk assessment for these workplaces. So different types of biological hazards to consider are microorganisms such as bacteria. Some examples of this are Salmonella, E. coli, and Mycobacterium, like tuberculosis. These all can cause infections and illnesses. Viruses can cause a range of diseases, from anything mild, such as the common cold, to more severe infections, like we talked about, the human immunodeficiency virus, or HIV. Another common virus experienced in, typically the colder weather times, besides the common cold, are the flu virus or influenza. And then, more recently, we are all affected by the global pandemic with the coronavirus. Some other things to be aware of, especially in areas where we're handling food, are mycotoxins that can be produced by fungi, and then also just food and other areas that can produce molds can lead to very high health risks. Chemical hazards are types of workplace hazards that affect employees who have an occupational exposure to chemical preparation, whether it's a solid, liquid, or gas. Those some substances are pretty not very harmful to employees. Workers might just have a sensitivity or a small reaction if they're exposed to it, like a skin irritation, like a rash, or it might kind of cause a temporary breathing problem, like a cough. But there are chemical hazards that can cause very severe reactions and can lead to death, even if a worker is has an acute exposure. So meaning, one-time potential or short-term exposure. So chemical hazards are caused by liquids like paints, cleaning products, acids, and solvents. Something that I think sometimes some companies may overlook when we're talking about chemical hazards is the fact that a vapor or fume off like a solvent or a fume from welding is hazardous. Something like example of welding on stainless steel can produce hexavalent chromium exposure in the welding fume itself. And hexavalent chromium is a very well-known cancer-causing agent. And so I've encountered workers that have been welding on stainless steel without respiratory protection before because they were unaware of this hazard. Also, other potential chemical exposures are gases like propane, carbon monoxide, helium, acetylene. There are a lot of chemical exposures to gases that sometimes can potentially get overlooked too, but it can be very, very harmful. And then flammable materials such as petrol, diesel. We talked about solvents earlier. Those are very flammable. They have very low flash points in their vapor and can be very ignitable at even freezing temperatures. There are other like explosive chemicals, and pesticides can be very highly hazardous as well. And lastly, for our 5 safety hazard types, we have ergonomic hazards. Ergonomic hazards can affect employees across all industries, but more so those who work responsibilities and work conditions put a strain on their bodies. So workers that have to do a lot of manual material handling, like heavy lifting or sitting for long periods of time, can cause severe damage. In the past few years, there's been studies that relate what they call chronic sitting, or someone that has a desk job where they're just sitting at a computer all day. They relate that to be as hazardous to one's health as smoking cigarettes. So it's definitely something that's kind of newly considered a hazard, that these desks or workers where we're sedentary, we're not moving around a lot, can cause a lot of health hazards. Also, employees can get different types of inflammation, which can lead to things such as carpal tunnel syndrome, tendonitis, and low back injuries. And again, these are typically seen not just with workers with sedentary desk jobs, but I've seen carpal tunnel syndrome and tendonitis, particularly with workers with desk jobs, but also workers that are doing a lot of repetitive motion, a constant repetitive motion with a high frequency of doing that can really lead to, especially like with manipulating things with our hands, can lead to carpal tunnel and tendonitis, which is inflammation of your tendons. Most common ergonomic hazards include poor posture, vibration, frequent lifting, using too much force, and improperly adjusting office furniture. So maybe that like our eyes or our neck or how we're sitting is causing strain on the body. Okay, when we're looking at like the construction industry, or really any industry, we've talked about hazard identification and assessment. In construction, though, unanticipated hazards can arise due to the changing work environment. We've got project timelines, a sequence of events. A lot of time there is high pressure to have a fast pace on some construction projects because we're trying to meet schedule deadlines. And so hazard identification and assessment is a crucial part of an effective safety and health program. We will oftentimes do a hazard identification or a job hazard analysis daily on a construction site because of that changing environment of the nature of the construction industry itself. We need to ensure that we're looking at what is today bringing for our workers and what hazards do we need to control. One of the root causes of construction industries is the failure to identify or recognize hazards that are present or that should have been anticipated. And so that's why it is a critical element of an effective safety and health program to provide a proactive, ongoing process to identify and assess these hazards throughout the process, not just at the beginning of the work, but as an ongoing part of the construction site. All right, so to identify and assess hazards, employers, and workers must collect and review information about the hazards present or likely to be present, that day or that week, whatever the company's timeline is on the hazards changing at the job site. We want to conduct frequent and regular inspections of the job site to identify new or recurring hazards. We also want to investigate injuries, illnesses, incidents, close calls, near misses, to identify the underlying hazards or the root cause of that any of those occurring. And then that helps us to identify what are our gaps or our shortcomings in the safety and health program. And then it allows us to recommend and implement controls for those hazards to prevent those injuries, illnesses, and incidents from occurring in the future. We want to, or we're able to group similar incidents together to identify trends in the injury, illnesses, and hazards that are reported. That can kind of help make the work a little quicker, as long as we're not, missing out on important details by grouping those things together and looking at the trends. All right, so to identify and assess hazards, we must consider hazards associated also with non-routine situations, like emergency situations. For each hazard identified, we want to determine the severity and the probability or the likelihood of incidents that could result. And we want to use this information to prioritize corrective actions. Some hazards, such as housekeeping, tripping hazards, slips, falls, those things can and should be fixed as they are found. So I've had employees that were tasked with doing maybe a weekly safety audit of their work area, right on the audit that there was an extension cord laying on the ground. So my recommendation to other health and safety managers is to encourage employees, instead of writing something like that down, to take personal responsibility, whether they left the extension cord there or not, to pick it up and put it in the place that it's supposed to, where it belongs, for safe storage. So, taking care of those things as we find them, rather than reporting them and expecting someone else to take care of it. So fixing hazards on the spot like that emphasizes the importance of safety and health and takes advantage of safety leadership opportunity. It goes back to that behavior-based safety approach, where we maybe give workers positive reinforcement and encouragement to do these things, and to take personal responsibility over their own safety, but also of the safety of their fellow coworkers. And we will talk about fixing other hazards identified using these processes in the next section. All right, so we've talked a bit about the hierarchy of hazard controls, or just of controls. This is a very common pictogram you may see. Comes from OSHA, actually. And the hierarchy of controls is a method of identifying and ranking safeguards to protect workers from hazards. So they're arranged from the most effective at the top to the least effective at the bottom. And we see that it forms this hierarchy, or kind of a upside down triangle or pyramid, in terms of the most effective being like the base or the largest part. So elimination, which would be to physically remove the hazard, is the most effective. Substitution, or replacing the hazard with a safer alternative, is the next most effective. And so this is an example of this might be substituting a chemical that is used in your process for a less hazardous chemical. The next most effective is going to be engineering controls. So isolating people from the hazard. An example of an engineering control is going to be a machine guard, a guardrail to prevent falls, a ventilation system to protect employees from health exposure of, breathing some hazardous chemical or fume. So all of these things are engineered and designed to protect employees, They generally do not require any employee interaction or action to isolate or protect the employee from the hazard. The next most effective method as we get towards the bottom are administrative or work practice controls. And these are going to be procedures, or we're changing the way people work. But by doing so, it's a process or a procedure that the hazard still exists, but we're changing how people work with the hazard. And so now we're getting into where we're relying on the employee to do something. And once we get into hazard controls that rely on employees to do something, that's when they become less effective, because we are having to include and consider human error and human actions. And we saw earlier that 80% of accidents that occur are caused by unsafe acts. So that's why these get less effective as we go down the level of controls. And then lastly, we will provide employees personal protective equipment. And this protects the worker from hazards that still exist. Maybe flying debris in the air that could get in the eyes, falling objects that might hit the head or fall on the foot. We would provide head protection, eye protection, foot protection, but that hazard still exists. And we have to rely on our employees to wear the PPE, to keep up with it, to make sure it's not damaged, to report if it's damaged, to take good care of it. There's a lot that we're relying on employees to do and do correctly. And there's no PPE out there that protects employees from 100% of the hazards 100% of the time. So that's why it's the least effective. And none of that is to say that there's not a place for PPE or there's not a need for PPE. There certainly is, and we'll talk about that in the next few slides. But it's just to say that that should not be our first choice when we're looking at protecting employees from hazard and risk. So some more examples of the hierarchy of hazard controls. So elimination, make sure the hazard no longer exists. So by changing how we do work, say we used to have a worker work at heights. And I have an example of this. I've worked with catfish farmers in the past, and they have feed bins where a feed truck comes and deposits food into like this silo for their catfish food. And there's a ladder on the side of the silo, and the method that a worker would have to climb the ladder and go up to the top of the silo and open the hatch for the feed truck to be able to load and fill up the silo with the feed. So this was, putting the worker in harm's way by having to climb up this ladder about 20 feet in the air. So we were able to eliminate that hazard by attaching a lever and a handle to that hatch that would allow the worker to open the hatch from the ground. So that's a great example of eliminating the hazard. There was no longer a need for that worker to go up the ladder and be exposed to that height. The next level of hazard control is substitution. So we're changing out a material. I gave an example earlier about changing out a chemical for another chemical in our process that's less hazardous to employee health, but it still is effective for our process. Another example would be using a material or a tool, like using a cherry picker as an alternative to a man basket, because it's a safer for our process and for our employees. All right, our next level of hazard control is engineering controls. We talked about these help reduce exposure by preventing hazards from coming into contact with workers, but it still allows workers to do their jobs and doesn't really require any action on the employee for them to be effective. So Examples would be protecting a worker from heights by installing guardrail systems and toe boards. The worker shouldn't have to do anything for these to be effective controls from them having to work at a height. Administrative controls change the way work is done or gives workers more information by providing workers with relevant procedures, training, or warnings. They're often used together with higher level controls. So a permit to work system, like maybe a hot work permit stating that we have completed all of these tasks to control any type of hazards that might exist with welding in the work area. Working at height training, having warning signs. So it's important that we note that we don't just use administrative controls, but we use them as a part of our comprehensive hazard control system. And then again, as we talked about, our last resort is going to be personal protective equipment, or PPE. PPE needs constant effort and attention, which includes proper use and training, and enforcement, honestly, from management of employees using it. So examples are safety glasses, personal fall protection systems, hard hats, safety shoes, gloves, all types of things that can protect the person. So we've talked about our hazard identification techniques, and these are just as effective in a general industry setting as a construction site. We talked about on a construction site the use of performing a job safety analysis, even potentially daily. If the work environment on the construction site has changed very drastically from the day before, then we need to break down the jobs that the workers are doing that day into each component task and identify the associated hazards. And then look at each step again for the potential risk, and then implement control measures or preventative measures to ensure that the employees are not being exposed to these hazards. Checklists are very effective to conduct these job hazard analysis or job safety analysis. Other hazard identification techniques. So, of course, looking at past incidents, near misses, accidents can help reveal potential hazards. Encouraging employees to report near misses and incidents creates a culture where employees feel safe to report those, and that we are not blaming the employee for doing something wrong. We're just encouraging a culture that we're learning from our mistakes, and which will help prevent future occurrences. And that really leads to a really positive safety and health culture. Having regular safety inspections involving systematic walkthroughs of the workplace or facility to identify hazards, and having audits that involve a more comprehensive review of our safety policies, procedures, and compliance. Safety data sheets are an important hazard identification tool. The OSHA standard for hazard communication, and there's a globally harmonized system for hazard communication related to chemical hazards, requires that we have a safety data sheet for every chemical on site or on a work site. So those are great tools to have to help in our job safety analysis, because the chemical manufacturer or distributor must identify the physical, health, and environmental hazards that are related to handling that chemical. It also prescribes what protective measures we need to use, what our handling techniques, storage, firefighting, first aid, like all of those emergency response measures are. So that really is a great tool to utilize when we are doing our job safety analysis, to ensure that we are considering all of our chemicals that job may handle, and relying on that information from the manufacturer to help us identify the hazards and recommend controls for those chemicals. Additionally, utilizing technology-based solutions such as sensors, monitoring systems, and predictive analytics can aid in identifying hazards, especially in high-risk environments. These can be used to provide real-time data and allow for proactive risk management. And these are great tools to use in things like confined space entry, any type of environment where potential exposure to a highly hazardous gas or fume may occur. There's even systems that monitor musculoskeletal disorders for employees and can be predictive and potential where an employee might have exposure for a potential injury, and then having a physical therapy program or a physical fitness program where employees would strengthen that area. That can really be a great proactive risk management tool to reduce injuries. Once we've identified risks and hazards employees are potentially exposed to, we want to decide how likely is it that someone could be harmed. And so the frequency or likelihood or probability or other words we might use. And then what is the potential severity or how serious could the harm be if it could occur. And we do this to assess the level of risk. We decide who might be harmed and how. And then we also consider what are we already doing to control the risk. So this is kind of giving us the whole picture or comprehensive look at the risk and hazards themselves. And so this can give us, doing this severity and likelihood, we typically look at this in kind of a matrix format, where we are looking at the cross section of the severity and the likelihood. So if and we do this to consider, is there an acceptable level of risk? And this can vary based on the company and based on the task at hand. But for example, if we have a negligible severity, so the level of potential harm is negligible or minor, and then the likelihood or chance of harm is very unlikely or unlikely, we can add those two numbers together. And if we have, or multiply them, sorry, if we have a number of risk between 1 and 6, then and your company decides that that's an acceptable level of risk. If we move up to a higher number where like 8 through 10, then it's tolerable if we are strictly monitoring the situation, but we're going to try to improve it. But we would put a high priority on unacceptable risks that we must evaluate for hazard controls or different or more effective hazard controls. That would be a severity and likelihood risk rating of 12 to 25. And here's an example of looking at this risk assessment matrix and like a 5x5 matrix, like we see here. Kind of can make that as a visual that we can see, like if the severity of the risk or the hazard is a 3 injury, a 4 major illness, or 5 a fatality. And if it is fairly likely, or very likely that and those were to occur, you can see that those are going to be in red. In terms of should be our very high priority for us to address and control these hazards as quickly as possible. Okay, other things terms you might hear is an occupational health and safety manager, or a lost time injury. You might also hear something like a reportable or recordable injury. And those are somewhat interchangeable. The reportable or recordable might be related to what the government that your company is operating within requires by law to be reported. But you just throughout all companies, you might hear a lost time injury where an employee might that might be injured, but not have a lost time injury, meaning they're able to return to work. But if an employee is injured with to a level where they must miss at least one full workday, and it might not even be considered the next regularly scheduled workday, even if the next day is not a regularly scheduled workday, but a doctor determines they would not be able to work the next day, then that could be considered a lost time injury. A near miss is an unintended incident that occurred but did not lead to injury or physical property damage, but under different circumstances could have become an accident. So, in this picture here, we have an object that's fallen to the ground. It didn't cause any damage or injure anyone, but had this person walking very close to the box been, one step further, the box could have fallen on them. It's also some things that are potentially used interchangeably: an incident versus an accident. An incident is an event that gave rise to an accident or had the potential to lead to an accident, or an accident is an undesired event giving rise to death, ill health, injury, damage, or other loss. Incident investigation and analysis. In 1966, Frank Bird contributed to the theory based on his analysis of over 1.5 million accident reports. He produced a triangle that shows a relationship that there's one serious injury or accident to 10 minor injury accidents, and then to 30 damage-causing accidents. And then every one serious injury accident that occurs, there were 600 near misses. So Heinrich is another long, well-regarded expert in workplace safety and health. He also claims that major accidents can be predicted and prevented by acting on minor incidents, and especially those near misses, and looking at the behavior of employees. So what this is telling us is there's a huge importance on encouraging employees to report near misses, and for us as health and safety managers to put a high priority on investigating those near misses, because there are 600 near misses, so 600 opportunities to investigate a hazard or a risk that could have prevented that one serious injury or 10 minor injuries or accidents from occurring. So here's another example very closely related to this, the DuPont safety pyramid. So for every one fatality, there were 30 serious disabling injuries, 300 lost time accidents, 30,000 near misses, first aid, medical aid, modified work, minor incidents, and 300,000 unsafe conditions and unsafe acts. So you can see that this can be, there's exponentially a greater amount of things occurring that are opportunities for us to observe and control the risk associated with these unsafe conditions and acts. 30,000 near misses were opportunities that we could have investigated that by doing so could prevent those 300 lost time accidents, those 30 serious disabling injuries. And of course, we would want to prevent that one fatality. All right, so now that we've looked at the importance of investigating incidents, we want to look at some ways to do so. So we have some investigation techniques, looking at the task, material, environment, personnel, and management. So looking at, all elements involved, the who, what, when, where, how, and why of the incident. Utilizing a report and checklist is very helpful when completing an accident, incident, and near miss investigation. So this just allows us to have a systematic way to document that we conducted this investigation, and kind of helps walk us through and making sure that we have covered all the details that are needed. So here's another look at what that form might look like. We're documenting the people involved, and that can include paid employees. It can include volunteers on site and community members. Involving the supervisor and getting their input on the incident or accident, what were the possible contributing factors. And we're ultimately trying to seek out what is the root cause of the accident so that we can then implement controls so that the accident or incident or near miss does not occur in the future. And as a part of this investigation, some of these forms might also include conducting a limited risk assessment just on the task that had occurred. And then, of course, suggesting actions to prevent recurrence, and then ultimately, implementing those suggestions. So incident prevention. So of course we want to implement control measures. Those could include safety procedures, work instructions, providing adequate training, having effective communication with employees, ensuring good housekeeping, ensuring that we have effective guards, safety devices, and warning signs, conducting regular safety inspections, and conducting risk assessment might all be effective control measures that can be used as a part of an incident investigation. So the types of incidents we should investigate should be, of course, and priority given to any serious or disabling accidents. Then next in priority would be minor or first aid injuries, proper injury accidents that result in property damage, and then near miss incidents. All right, who should conduct an investigation? We of course want the first line supervisor involved, the safety committee, the safety director, or the safety person, or you as an occupational health and safety manager. And the best and most effective incident investigations occur when all of the above are included, because we are looking at the incident from multiple perspectives, and different people bring different experiences to the investigation. So this way we can ensure that we have a comprehensive review of the incident that occurred. All right, before attempting to gather information, we want to examine the site. For a quick overview, we want to, especially in an accident situation, we want to take steps to preserve any evidence and identify all witnesses that could have witnessed the accident occurring. And based on your knowledge of the work process, you may want to check things like positions of the injured workers, equipment being used, products being used, the safety devices in use, the position of appropriate guards, and controls of machinery, if they existed. Was there damage to the equipment? What was the housekeeping like in the area? Could a wet spot on the floor that was not cleaned up contributed to a slip? Could a cord on the ground contributed to a fall? What were the weather conditions? This can definitely contribute to accidents on a construction work site, but I've been in many facilities that have leaky roofs, or water, or things like that were able to leak and get on the floor, maybe not cleaned up. So we talked about housekeeping being a huge priority and something that's pretty simple to ensure occurs properly. What were the lighting levels? Was there sufficient lighting? What were the noise levels? And then just things as simple as like, what was the time of day? How long had the worker been on their shift? That can contribute to injury and illness, especially been involved in accident investigations where an employee had a heat-related exposure illness, that he had been working on a coke oven for 14 hours and had not been properly hydrating himself. So, that he'd been working overtime on a second shift. And so that really contributed to his illness. We talked about the use of work permits. We talked about hot work permit earlier, about anything that like welding or cutting, grinding that might create a potential for a spark. Then we need to make sure that we're filling out a permit and we're controlling any potential hazard that occur. We're sweeping the work area, we're removing any flammable objects or materials. But we also have things like cold work permits. So it's a document that specifies precautions that identify hazards and controls all work that's not hot or radiographic in nature. And then we also have radiography work permits that prescribe specific precautions and identify hazards and controls all work involving radiographic work. We can also have a vehicle or mobile equipment plant entry permit that specifies precautions and identifies hazards and controls with any work involving entry of a vehicle into a hazardous area in the plant. Another common work permit is a confined space entry permit, which gives specific precautions identifying hazards and controls all work involving entry into an enclosure that is considered a confined space, which means it has limited means of entry or exit and is not designed for continuous occupancy. And then we also can have excavation permits when any type of work that involves excavation or trenching even. These can have tragic and catastrophic consequences when in like utility work, when we're not providing the proper control methods in place, like trenching and shoring, to make sure that the earth doesn't move and collapse on workers while they are excavating. We can have lifting permits, operations that come with their own set of hazards and dangers. So not all lifts require permits, but if we're lifting something with a crane and there's a lot of pedestrian or vehicle traffic around, then we may need to include a work permit that ensures that we are complying with procedures and protocols that allow for the safe lifting of that, considering the project and the surrounding environment. Here's some other examples, pictures of working at height permit. There's live electrical work permits, hot work permits. And with hot work permits, you can see a tag like this may be attached to the area where the hot work will be occurring. So again, hot work is where we have an open flame or something that could generate a source of ignition, like welding, flame cutting, drilling, brazing. Even grinding sometimes can cause sparks enough that where a hot work permit would be needed, especially in an area where there's highly flammable chemicals or a large amount of combustible materials being stored. We want to make sure that we are following the hot work permit and ensuring that we're doing this work safely. Confined space permits are also something that's very important to follow. It ensures that workers entering confined spaces like vessels or tanks are doing so in a safe manner. It requires that we do atmospheric testing to make sure that the air is safe for the employees to breathe. And then we also have an attendant outside the space that is there to continuously monitor the employees to ensure that they're safe while they're in the space. All right, so we've talked about, being an occupational health and safety manager and, working with a multinational company, working with contractors and employees that we have hired through an staffing agency. So we want to, how do we manage communication, especially about these really important safety topics across multiple teams? So the most effective way to do this is to ensure that our employee safety is a priority, and that communicating with employees the proper procedures and protocols is your priority in terms of making sure that it's communicated effectively throughout the entire company. So the way that you conduct this can differ based on the format of your organization. Here we have 9 ways to communicate safety in your workplace. So it might be that a combination of these different ways might be the most effective, but sending an email or newsletter is a great way to communicate with those workers that have easy access to their email and a computer. I definitely recommend having like a monthly safety focus where you send out a safety bulletin on email. We also, a lot of workplaces have televisions, maybe in the break rooms and throughout the workplace, where they have important information that cycles through on a presentation throughout the day. This is a great place to also have reminders about the safety focus. But you could also have this printed on like a safety newsletter that you pass out with employee paychecks, or you post on bulletin boards in key places like the break rooms and the time clock. Ensure you have adequate signage throughout the workplace, like having engaging posters, infographics where employees go. So like where near a time clock, in the break rooms, making sure you have adequate signage in high risk areas or where PPE is required. Other types of signage would be on spaces that are considered would require confined space entry, or where like hot work would not be allowed. Using pictures and videos helps to engage employees. So no matter how you're communicating your safety message, ensure that you use pictures and videos. Even I've seen a poster of a close-up of somebody's eyeball with like a staple sticking out of it, and the whole point of the poster was to wear your safety glasses, of course. So that definitely catches employees' attention. Holding regular meetings about safety does communicate to employees that safety is a priority. So engaging them personally by having face-to-face meetings is a great way to ensure that you're effectively communicating your safety procedures. But having an open format where employees are able to voice their concerns at these meetings will help keep safety at the top of employees' minds. Some companies incorporate the safety training with having a free meal for the employees, once a month, or some way to encourage the employees to attend and look forward to that training is a great idea. Requiring appropriate training, again, making mandatory training a requirement, is typically required in most countries' safety and health laws. So it's a great idea for this to be a common practice to ensure that you have a specific set of training prepared for new employees, and then regularly scheduled training sessions that refresh that training, again, at a minimum on an annual basis. But having a safety topic, 1 or 2 topics a month that you're sending out on email or newsletter, and then also having a monthly safety meeting on those topics helps to reinforce this information and keep safety at the top of your staff's minds, and refreshing important skills and knowledge too, like reviewing lockout tagout procedures, or safe driving skills for forklift drivers. Those are just a few examples. Making safety a part of an employee's review process and holding them responsible for unsafe actions, but also rewarding those who help to contribute to a safe workplace is another way to just make safety an integral part of a worker's daily life, is another way to effectively communicate your commitment and the company's commitment to the safety and health culture. Not skimping on the safety gear budget. So, making sure that our personal protective equipment is the right gear, not going for the cheapest thing out there, but showing employees that you care about them by providing them, doesn't even have to be top of the line, but really, nice boots, or a new pair of boots every year, or a new pair of gloves when they get holes in them. That sounds kind of obvious that we would do that, but I've seen companies that are very reluctant to supply employees with the appropriate PPE that they're required to wear. So that's another thing that can really go a long way in worker satisfaction and a positive safety culture. Having routine safety checks, so being proactive and not just reactive, like when a worker has an injury, but doing safety audits, having your supervisors conduct those, having a safety committee and having them have responsibilities in conducting audits in certain areas on a daily, weekly, monthly basis. Having your supervisors ensure all workers are wearing their PPE and using equipment safely are all examples of ways that you can have this, that safety is a routine part of the workday. And then at your safety meetings, or however you want to communicate this, having either you as a manager, or I've seen this be effectively done by employees themselves, sharing a case study or an incident report, bringing a personal side and a personal message along with, a real life experience can really help bring that message closer to home and bring employees' minds back to the importance of safety while they work. Okay, so we've talked about effective communication strategies. We've also talked about behavior-based safety, but there's a few different approaches that we can take to behavior-based safety. So micro approach is that there are consequences that follow after a behavior. So consequences can affect future behavior depending on reinforcement and feedback. So the behavioral-based safety process includes identifying behaviors that can be problematic, such as unsafe or risky behaviors, determining the root cause of the identified behaviors, creating possible corrective actions, evaluating corrective actions, developing the necessary processes to carry out the behavior-based safety program, implementing the program, and then evaluating data gathered from the behavior-based safety program, and checking to see whether the safety or the has improved, or the problem that was trying to be solved has been solved, and then acting based off that feedback. The macro approach to behavior-based safety aims to set permanent change in the organization's safety culture. So the total safety culture that most organizations aim to achieve within their safety programs is assessing and analyzing the culture in the workplace, teaching and training every employee about behavior-based safety in its context in the workplace, encouraging employees to participate in the behavior-based safety program, reinforcing awareness, accountability, self-observation, and self-management. So, just reinforcing that employees take personal responsibility for safety in the workplace for themselves and for their coworkers, providing continuous support and commitment to the employees, and then evaluating and providing feedback, whether it be considered positive or negative. So following the key concepts of this ABC model, in implementing behavior-based safety, so A stands for the antecedent. So any stimulus that occurs before a specific behavior, like procedures, employee training, things that provide aids to make the job safer, that drives behavior, which is our B. So anything that we can see an individual do or say is considered behavior. And then C, our consequences, motivates that behavior. So any event that occurs after a specific behavior. So the feedback, recognition, or maybe consequences like discipline or encouragement to improve. So our worker education and training allows us to provide safety program awareness. We need to assess our current training needs, assess job-specific training needs. We need to understand the program roles. So in our safety program, there are different roles and responsibilities for everyone, and ensuring that workers are provided the education and training to do so effectively. And then also education and training on hazard prevention and controls. So to provide training, we want to develop training about the safety and health program and benefits. We want to make sure training is presented in a manner and language that workers understand. So we must make sure, like we talked about, if we work for a multinational company or a company that employs workers that speak different languages, that we are providing the training in a language that all workers understand. So that might mean having interpreters or translators, or having multiple training sessions for different language learners. And then including information about emergency procedures. So all workers need to understand the safety and health program structure, plans, and procedures in order to participate. Program awareness training helps workers understand why we're having a safety and health program. So when they understand why, it generally can help them understand why they need to participate and why it benefits them. It also helps them to understand their roles and responsibilities, and helps them learn how they can be a part of planning, implementing, and improving the program. So to identify topics for training, we want to consider the key topics you'll need to cover in order to raise awareness. So this can include your safety and health policy, goals, and procedures. We want to make sure everyone is aware of specific goals and activities, as well as the overall vision for the program. In key takeaways you might want to focus on would be safety and health as a core business value, that the program focuses on finding and controlling hazards before someone gets hurt or sick, so that we're being proactive, not reactive, that workers need to participate because they know the most about hazards and how to control them, and that we as a company will review the program and we want to make it better. So we're always trying to strive for continuous improvement. For our awareness training, we want to make sure that everyone in the training knows who our program contacts are, so knows that who they need to go to if they have questions or ideas, what your company's process for reporting hazards, injuries, illnesses, and near misses are. So training should include explaining those procedures and options for reporting. It also should include the employer's responsibilities under the program and really communicate well the employer's commitment to safety and health, setting the program goals, providing resources, assigning roles and responsibilities, and how you're encouraging, an open door policy and open communication. It should also communicate worker rights under the Occupational Safety and Health Act of 1970, so the OSHA Act, and what to do in an emergency. So we also want to communicate that the program isn't static, so that we're, again, always looking for feedback and input. We want to see how it's performing, and we also are striving for continuous improvement. So we've talked a lot about workplace emergencies. So what is a workplace emergencies? We need to know this to make sure that we're able to effectively train our workers. So we have to consider any workplace emergency that can threaten workers, customers, or the public. It could disrupt or shut down operations and could cause physical or environmental damage. Emergencies can be natural or man-made. So we have to consider any type of weather-related emergencies like hurricanes, tornadoes, earthquakes, floods, wildfires, winter weather. But then we also have to include like man-made emergencies like chemical spills, a disease outbreak, release of biological agents, explosive issues like nuclear, radiological sources. And so that's actually just a small list of the hazards to consider. Many types of emergencies can be anticipated in the planning process, which can help us control these hazards and prescribe plans to be put into place in these unpredictable situations. So we try to plan and prepare. So hopefully these emergencies never happen. But if they do, then we're going to minimize the risk of physical damage as well as employee injury. We wanted to develop an emergency action plan as a part of this emergency response program. So it's intended to facilitate and organize our actions and what we're going to do if a workplace emergency is to occur. And well-developed emergency plans include providing proper worker training so everyone understands their roles and responsibilities within the plan, and it will result in fewer or less severe worker injuries and less property damage in the event of an emergency. A poorly prepared plan or one that is completely neglected can result in confusion, which can lead to higher rates of injury or illness and higher rates of property damage in the face of an emergency. OSHA has some minimum requirements for effective emergency preparedness and response plan. So at a minimum, businesses are required to have an emergency action plan, must include evacuation floor diagrams, and those evacuation floor diagrams must include a primary and secondary exit, show the pathway to those, and not utilizing elevators. You cannot have an exit that goes through a bathroom. You have to account for anyone with like wheelchair, how are we going to safely get them to a place of refuge? And then you also have to identify your assembly area. So we also have to include a method for reporting fires, emergency escape procedures and route assignments like we just saw in the last slide, procedures for accounting for workers after an evacuation, such as having a designated assembly location, but having a list of the workers that are on site that day and having the names and titles of individuals that are responsible for duties under the plan. Procedures, there might be procedures for workers that remain to perform shutdown of critical plant operations, or we might assign workers to operate fire extinguishers or fire extinguishing systems, or perform other essential services. Those employees must be identified and trained properly. And then we might have employees also that have rescue and medical duties to perform in emergencies. In addition to the requirements of the OSHA Emergency Preparedness and Response Standard, some other actions may include posting emergency numbers in the workplace for the fire brigade, the fire department, or other appropriate emergency responders. Another good idea is inviting external emergency responders to tour your facility to learn about the specific hazards of your facility and its processes. Some processes are very complicated or not well known to emergency responders, such as firefighters, paramedics. So inviting the firefighters from all the different shifts and giving them a tour helps to really coordinate the efforts in an emergency. We also want to arrange for to have training drills for responders and facility personnel to practice emergency procedures together. Having training drills is a really effective way that employees, whether you coordinate with our your outside emergency responders or not, is a very effective way to ensure that at least some of the people will act in an organized manner if there is in the face of an actual emergency, instead of acting with panic and confusion. Also, having designated emergency coordinators is another suggestion, where we have emergency contact persons that are knowledgeable of the facility's hazards and processes to ensure that their information is quickly accessible during emergencies. And that is something that is quickly accessible to all employees. Again, we would like to, if needed, designate staff that's responsible to inventory and maintain emergency equipment and supplies. Include a description of how the alarm system is going to be used to notify workers, including disabled workers. So those that may be hearing impaired, having flashing lights, or those that may be even vision impaired, having audible warning signs or a siren that alerts employees, and that the alarm itself might have 3 short blasts to indicate a fire, but 1 long continuous bell to indicate a shelter-in-place severe weather situation. So, and all of this must be communicated effectively through training to employees, so they know and understand what those what the alarm system is and what they should do based on the different distinctive sounds. Also, we would want to have a plan to store or have duplicate copies of important legal and accounting records as a backup if some property damage were to occur, so that we can consider our business continuity. Okay, so everything we need to know about personal protective equipment. Switching gears a bit here. Personal protective equipment refers to protective clothing for the eyes, head, ears, hands, respiratory system, body, and feet. So it's something employees are going to wear to help minimize risk of injury or infection or exposure. So it serves as our last line of defense after engineering and administrative controls are insufficient to fully reduce or eliminate our risk. So PPE can include safety goggles and face shields that can be used for tasks that could cause eye damage or loss of vision. It could come from sprays of toxic liquids, splashes, and burns. Face protection can include safety glasses, safety goggles. Some have impact protection, while others would protect the eye and the surrounding area from, sprays or, fine particles. We may also, sometimes jobs require that we wear safety glasses and a face shield, so that it protects us from both impact and flying particles. And then also wearing shaded eye protection for things like welding, soldering, and lasers that are made specifically for those things. Respiratory protection, using like a respirator, will be required as like an interim protection if we are going to be installing a ventilation system or engineering controls. It does require that we have a respiratory protection program that ensures that we do annual fit testing on employees for the respirator to make sure that it fits correctly. Employees may have to undergo a medical evaluation to ensure they're medically and physically fit enough to wear the respirator. And employees must be trained on the proper use of wearing the respirator, when they should wear it, how to take care of it and clean it, when to change out cartridges and filters. So there's a lot that goes into respiratory protection. If employees are wearing disposable respirators, they want to be trained to know that they're to dispose of that respirator after every use. If surgical masks are used, they should be disposed of after each use. And any mask should be replaced if it gets damaged or soiled. Other types of PPE for head protection include hard hats and headgear. These should be required for tasks that can cause any force or object to fall on the head. There's also head protection or headgear that is electrically rated to protect employees against electrical shock. Body protection can include safety vests and suits, but it's going to protect the body from injuries from extreme temperatures, flames, and sparks. So they might be coated with like a flame retardant material, toxic chemicals, insect bites, and radiation are some examples of PPE that is used for body protection. Hand protection will include safety gloves and should be used for tasks that can cause hand and skin burns, absorption of harmful substances. Some safety gloves can be made of strong materials like Kevlar that help limit cuts and fractures, amputations. So there's lots of different uses for gloves because our hands are the main tools that we use every day, and we need to make sure that we are protecting those tools by using the correct glove for the hazard we're exposed to. Then we also have foot protection, and that can include knee pads, safety boots, and safety boots may include a safety toe or a steel toe. They also can include metatarsal foot protection that help prevent injury to the top of the foot from falling or rolling objects. They can have soles that are rated to be used in high heat environments or in electrical environments where they help to kind of, they're not electrically conductive. And then we also have shoes that are electrically conductive for working in explosive atmospheres where a static electricity charge would need to be dissipated. And then, we want to have a good sole and have our shoes in good condition for working around slippery surfaces and to ensure that we have a good footing. So next we have fall protection. This PPE can include safety harnesses and lanyards. We want to make sure we're using a 5-point safety harness for any time a fall from a height of 4 feet or higher is a potential. These should strictly be used for tasks that can cause falling from heights. OSHA has eliminated the ability to use a body belt, which is just one strap that goes around the waist. For fall protection, you can use it for worker positioning, but the 5-point harness is required for any potential for falls. Hearing protection, like earmuffs and earplugs, should be used for tasks that can cause hearing problems and loss of hearing. When we have high noise levels, we want to make sure that we offer employees several different options of hearing protection to make sure that they're finding something that's comfortable for them to use and that encourages the use of it, like single-use earplugs. They also have preformed or molded earplugs and then earmuffs. All right, so regulatory compliance for construction sites. Nearly 6.5 million people work at approximately 252,000 construction sites across the nation on any given day. The fatal injury rate for construction industry is higher than the national average in this category for all industries. So construction sites can be some of the more dangerous work sites that workers can be involved in. Potential hazards that are commonly seen on construction sites are falls from heights, trench collapse, scaffold collapse, electric shock and arc flash or arc blast, failure to use proper personal protective equipment, and repetitive motion injuries. OSHA has their most frequently cited standards. And so they update that every year. But pretty commonly, these top 10 standards are the most frequently identified when they go on site and conduct inspections. And those include violations related to scaffolding, fall protection, excavations, ladders, head protection, excavations, hazard communication, fall protection, just general safety and health provisions with construction, and then electrical, like wiring methods, design, and protection. So let's address each of these. So scaffolding The hazard exists with scaffolds when they're not erected or used properly. Obviously the biggest accident that would occur with this would be fall hazards. But objects can fall off scaffolds if they're not erected correctly, and so people below can also be injured. So we need to make sure we're protecting workers from scaffold-related accidents. Doing so is estimated to prevent 4,500 injuries and 50 fatalities each year. So our control methods or our solutions for the hazards of scaffolding include ensuring that the scaffolds are sound, properly constructed and installed, that they're rigid and sufficient to carry the weight, plus a safety measure of 4 times the maximum intended load without settling or displacement, and that they're erected on solid footing. That no unstable objects such as barrels, boxes, loose bricks, or concrete blocks are used to support scaffolds or planks, and that scaffolds must not be erected, moved, dismantled, or altered unless they're under the supervision of a competent person. And that's really kind of up to you as the health and safety manager to appoint competent persons for scaffolding to ensure that they're being erected and utilized properly. They must be equipped with guardrails, mid-rails, and toe boards. Any accessories on scaffolds, such as braces, brackets, trusses, screw legs, or ladders that are damaged or weakened, must be immediately repaired or replaced. The scaffold platforms must be tightly planked with scaffold plank grade material or equivalent. There cannot be any gaps in the planking of the scaffold platform. And a competent person must inspect the scaffolding prior to use, and then designated intervals it must be re-inspected. Rigging on a suspension scaffolds must be inspected by a competent person before each shift, and after any occurrence that could affect the structural integrity, that person should be making sure all connections are tight and that there's no damage to the rigging has occurred since its last use. Synthetic and natural rope in suspension scaffolding must be protected from heat-producing sources. Employees must be instructed about the hazards of using diagonal braces as fall protection, because these are typically, not rated at nearly the amount of to withstand a fall of a person. Scaffolds can be accessed only by using ladders and stairwells. A person should never use the diagonal cross bracing as if it were a ladder to access the scaffold platform. Scaffold must be at least 10 feet from electrical power lines at all times. So that's another thing the scaffolding competent person needs to ensure, that they're not being erected where a person themselves or the scaffold itself is within 10 feet from overhead electric power lines. All right, our next hazard is fatalities, due to falls. It's consistently the greatest number of fatalities in the construction industry. A number of factors are often involved in this that contribute to falls, including unstable work surfaces, misuse or failure to use fall protection equipment, and human error. Studies have shown that using guardrails, fall arrest systems, safety nets, covers, and restraint systems can prevent many deaths and injuries from falls. So we want to consider using aerial lifts or elevated platforms to provide safer elevated working surfaces, erect guardrail systems with toe boards and warning lines, or install control line systems to protect workers near the edges of floors and roofs. Cover any floor holes, especially in those floor holes if there could be a drop or a person could fall more than 6 feet. Use safety net systems and personal fall arrest systems with the 5-point body harnesses, and ensure that you have anchor points that could withstand the forces of a fall. Improper use of ladders and stairways is another source of injuries and fatalities among construction workers. OSHA estimates that there are 24,882 injuries and as many as 36 fatalities each year due to falls on stairways and ladders in the construction industry. Over half of these injuries were serious enough to require time off of the job. So some solutions or hazard controls are using the correct ladder for the task, have a competent person visually inspect the ladder before use for any defects such as structural damage, split, bent side rails, broken or missing rungs, steps or cleats, and missing or damaged safety devices. Grease, dirt, and contaminants can cause slips and falls off ladders. Paint or stickers, except for the warning labels on the side of the ladders, can hide possible defects. So those should be discouraged from being used. And we do want to make sure that the warning labels on each side of the ladder remain legible. That is something I've seen OSHA look for in inspections. And if they become illegible, you can order replacement warning labels from the manufacturer. Additionally, we want to make sure ladders are long enough for the workers to safely reach the work area. So this encourages, the proper use of ladders, always maintaining 3 points of contact with the ladder, and not using a ladder in an improper way or in a way it's not meant to be used. Mark damaged or defective ladders, or tag them as do not use, or some companies will just destroy them immediately. Never load ladders beyond the maximum intended load or the manufacturer's rated capacity. Make sure the load rating can support the weight of the user, and that's going to include the material and tools that they'll be using during their work. And avoid using ladders that have metallic components near electrical work and overhead power lines. Hazards specific to stairways or slips, trips, and falls actually are a major source of injuries among construction workers. And, stairways are commonly used, and but I think because of that, people kind of don't take them as seriously as hazards such as, working at tall heights or from a ladder. So we want to make sure we keep stairway treads and walkways free of dangerous objects, debris, and materials. We want to make sure any wet or slippery conditions on stairways and walkways are cleaned up and dried immediately. We want to make sure the treads cover the entire step and landing, and that stairs that have 4 or more risers that are more than 30 inches tall have at least one handrail. Trenching is another hazard that has caused dozens of fatalities and hundreds of injuries in the construction industry. Some solutions to protect workers from trenching hazards are to never allow workers to enter an unprotected trench. Always use protective systems for trenches 5 feet deeper or greater, like shoring or trench boxes. That ensures that the walls of the trench don't collapse on the worker. Employ a registered professional engineer to design a protective system for trenches that are 20 feet deep or greater. And the protective systems provide sloping to protect the workers by cutting back the trench wall at an angled incline, which is inclined away from the excavation, and it's not steeper than a height of a 2 to 1, according to the slope requirements for the type of soil. So we have some different height depth ratios that are allowed for slope angle based on the soil type. So you can see, like for example, type A, which will be a clay soil type, we have a 3/4 to 1 height depth ratio at a 53-degree slope angle. And so depending, you need to ensure that you know the soil type that you're working with to ensure that you have the correct height depth ratio and slope angles as allowed per OSHA. We always want to provide a way to exit a trench, such as a ladder, stairway, or ramp. There's no more than 25 feet of lateral travel for employees in the trench so that they can quickly escape the trench if needed. We want to keep spoils of the trench at least 2 feet back from the edge of the trench. We want to make sure that trenches are inspected by a competent person before entry and after any hazard increasing event, such as a rainstorm, vibrations that could affect the movement of the earth or excessive loads. We also want to provide shoring to protect workers by installing supports to prevent soil movement for trenches that do not exceed 20 feet in depth. And we want to shield workers by using trench boxes or other types of supports to prevent soil cave-ins. Cranes are commonly used on construction sites. Significant serious injuries can occur if cranes are not inspected prior to use or are not used properly. So these injuries can occur when a worker is struck by an overhead load or caught within the crane's swing radius. Many crane fatalities occur when the boom of a crane or its load line come in contact with an overhead power line. So some hazard controls or solutions include doing pre-operation inspections. So doing a full check of all crane controls when a crane is not under load. We're going to do this prior to use or before each shift. Inspect the wire rope, chains, and hooks for damage. Make sure that as an operator that you know the weight of the load and know the capacity of the crane. And make sure that the load does not exceed the crane's rated capacity. And then a best practice is to raise the load a few inches to verify the balance and effectiveness of the brake system before you continue on with the full lift. Crane operators should always check rigging before use, and they should never wrap hoist ropes or chains around the load. We want to use straps or some other attachment that attaches to the hook. This attached to the chain is the hoisting mechanism of the crane. We should always fully extend our outriggers for the cranes. Never move a load over workers. We want to barricade accessible areas within the crane swing radius and keep any workers out or unauthorized workers and pedestrian traffic away from that crane swing radius. And we always want to watch for overhead electrical distribution and transmission lines and maintain a minimum safe working clearance of at least 10 feet. And that is of any part of the crane cannot come in within 10 feet of those power lines. And depending on the level of voltage flowing through those distribution and transmission lines, it might even require a greater clearance. Hazard communication is related to communicating hazards related to chemicals that employees may use. Failure to do so can cause chemical burns, respiratory problems, fires, explosions. So hazard controls would include maintaining safety data sheets for each chemical in the facility, making sure this information is accessible to employees at all times in a language and format that's clearly understood by all affected personnel, train employees on how to read and use the safety data sheets, and always follow the manufacturer's safety data sheet instructions for handling the hazardous chemicals, storing them, making sure you have all the hazard controls in place that is recommended by the chemical manufacturer. Employees must be trained about the risk of each hazardous chemical being used. They must be provided with spill cleanup kits in areas where chemicals are stored. We need to have a written spill control plan. Employees must be trained on how to clean up spills, all while protecting themselves and the proper dispose of the used materials. This can affect, our environmental laws. So we want to make sure that we're not disposing of chemicals in an improper manner that may, affect our waterways. We want to provide personal protective equipment and enforce its use as prescribed by the manufacturer of the chemicals, which is found on the safety data sheet. And we want to make sure we're using container labeling properly. We want to make sure that we're storing chemicals safely and securely per the safety data sheet as well. Forklifts is another common material handling equipment found on many types of sites, construction sites and manufacturing facilities. Approximately 100 employees are fatally injured and 95,000 employees have been injured while having serious injuries while operating powered industrial trucks or forklifts. The most common cause of these fatalities are forklift turnover accidents. And from my understanding, that typically occurs when a forklift starts to turn over, an employee tries to jump out of the forklift, and then they're crushed by the weight of the forklift itself, or the cage, the protective cage. So all forklift operators must be trained and certified as an operator, having a classroom training and a skills evaluation by a competent trainer. We should never allow any employee under the age of 18 to operate a forklift. We must maintain all equipment, including tires. We never want to modify or make attachments that affect the capacity and safe operation of the forklift unless we get written approval from the forklift manufacturer. And then that approval, or that affected capacity, is going to be listed on the capacity plate of the forklift. There's the standard capacity of the forklift or load, and then there is a blank spot on that load capacity plate for 2 different attachments, and you can get that in writing and list that on there from the manufacturer if they approve the use of an attachment. We want to examine the forklift truck for defects before using it. So requiring a pre-operation or pre-shift inspection of our forklifts should be required by every operator. We want to follow safe operating procedures for picking up, moving, putting down, and stacking loads. Workers should be trained to drive safely and never exceed 5 miles an hour, slow down in congested areas, and also go very slowly and be aware of slippery surface areas. Stunt driving and horseplay should be prohibited. Forklift drivers should never handle loads that are heavier than the capacity of the industrial truck. Any unsafe or defective forklifts should be removed and tagged out of service, and should be addressed and repaired by either your maintenance department or a contracted forklift repair company. Operators should always wear their seat belts. They should avoid traveling with elevated loads. They should assure that the rollover protective structure is in place, and they should make certain that the reverse signal alarm is operational and audible above the surrounding noise levels of the work environment. All right, so let's review some safety checklists that will be helpful in your endeavors as an occupational health and safety manager. They can help you take steps to identify hazards and suggest hazard controls that will help prevent injuries and illness and fatalities from occurring. So, evaluating eye and face protection, or safety glasses and face shields worn when foreign objects can get into the eye, or eye and face protectors selected based on the anticipated hazards, and our safety glasses and face shields worn when exposed to any electrical hazards. Hand protection, are employees wearing gloves that fit snugly, and are they wearing the gloves that are the right gloves for the job? So, making sure we're wearing welding gloves when we're welding, making sure we're wearing heavy duty rubber gloves for concrete work. Foot protection, construction workers should wear work shoes or boots that have slip resistant and puncture resistant soles. Safety toed footwear should be worn to prevent crushed toes when working around heavy equipment or falling objects. Head protection should also be worn, such as hard hats, or anywhere that a falling object could occur, or bumping a head on a fixed object, or also accidental head contact with electrical hazards. We want to make sure the employee is wearing the correct rated hard hat, that they're being inspected routinely for dents, cracks, or deterioration, that hard hats are replaced after any heavy blow or electric shock, and that hard hats are maintained in good condition at all times. We talked about the scaffolding safety, but scaffolds should be set on sound footing. Damaged parts that affect the strength of the scaffold are taken out of service. Scaffolds are never altered. or if they are, a competent person is evaluating them for safe use. Scaffolds should always remain fully planked, and scaffolds should not be moved horizontally while the worker's on it. So some scaffolds are designed to be mobile with wheels, and we're not allowing workers to remain on the scaffold platform while those mobile platforms are being moved. We shouldn't allow employees to work on scaffolds when they're covered in snow, ice, or other slippery materials. They should never be erected or moved within 10 feet of overhead electric distribution lines. Employees should not be permitted to continue working on scaffolds when there's bad weather that might, include lightning or high winds. Ladders, boxes, barrels, buckets should never be used as makeshift platforms, or should not also be used on the platform to raise the work height, because that would get the worker outside of the protective guardrail. Extra material is also not allowed to build up on scaffold platforms, and they should not be loaded with more weight than they're designed to support. Electrical safety guidelines include work on new and existing energized or hot electrical circuits is prohibited until all power shut off and grounds are attached. Effective lockout tagout systems should be used. Frayed, damaged, or worn electric cords or cables are promptly replaced. All extension cords have grounding prongs. Protective, flexible cords and cables must be protected from damage. They shouldn't be used around sharp corners, and projections should be avoided. We never want to run flexible cords through doorways or windows or anywhere a forklift or crane could run over them. Using extension cord sets used with portable electric tools and appliances that are 3-wire type and designed for hard or extra hard service. So we should always be using a 10 gauge, 12 gauge, or 14 gauge extension cords. We should never use 16 gauge or smaller. Those are used for household environments. All electrical tools and equipment are maintained in safe condition. They're checked regularly for defects and taken out of service if a defect is found. Workers should never bypass any protective system or device designed to protect employees from contact with electrical energy. Overhead electrical power lines are located and identified, and multiple plug adapters are prohibited. Additionally, signs are posted when appropriate showing the elevated surface load capacity. Surfaces that are elevated more than 48 inches above the floor or ground have standard guardrails to protect employees. All elevated surfaces where people or machinery could be exposed from falling objects will have a standard 4-inch toe board to prevent things from falling off. A permanent means of entry and exit with handrails is provided for elevated storage and work surfaces. That could be, a ladder or a stairwell. And material is piled, stacked, or wrapped in a way that prevents it from tipping, falling, collapsing, rolling, or spreading. Our hazard communication guidelines include a list of hazardous substances used in the workplace. So maintaining a chemical inventory of your hazardous chemicals in the workplace. Ensuring we have a written hazard communication program that addresses the use of safety data sheets, labeling of chemical containers, and how we conduct employee training. Each container of hazardous substances must be labeled at all times that identifies the product identity and hazard warnings that communicate the specific health and physical hazards. Safety data sheets must be readily available at all times for each hazardous substance used. We can maintain electronic log of these, but I also recommend having a binder in a place like an employee break room that makes it easily accessible for all employees at all times in case of emergency. Make sure that there's an effective employee training program for hazardous substances, and this should be conducted prior to employees working with a hazardous substance. The crane safety guideline: cranes and derricks are restricted from operating within 10 feet of any electrical power line. The upper rotating structure supporting the boom and materials being handled is provided with an electric ground. While working near energized transmitter towers, rated load capacities, operating speed, and instructions are posted and visible to the operator, and cranes should always be equipped with a load chart. The operator should understand and use the load chart. The operator can determine the angle and length of the crane boom at all times. Crane machinery and other rigging equipment are inspected daily before use, so a pre-operation inspection to make sure that they're in good condition. I recommend that this be documented along with your forklift pre-operation inspections, and you keep store records of these for at least 1 year. Accessible areas within the crane swing radius are barricaded, and unauthorized people should be prevented from being within that barricaded area. Taglines are used to prevent dangerous swings of or spins of materials when raised or lowered by a crane or derrick. This helps the load stay under control. Illustrations of hand signals to derrick and crane operators are posted on the job site, and that would be something included in your crane and derrick operator training. You should have a signal person that uses the correct signals for crane operators to follow. The crane outriggers should be extended when required to ensure stability. Crane platforms and walkways should have anti-skid surfaces. Broken, worn, or damaged wire rope should be removed from service. Guardrails, handholds, and steps are provided for safe and easy access to and from all areas of the crane. Load testing reports and certifications are available. This load testing requirement is going to be for any new in-service crane or anytime any serious repair is made. And then based on the use of the crane, load testing and inspections have a specific mechanical inspection that's required. And the frequency of that is related to the hazard level and the use of the crane. Tower crane mast bolts should be properly torqued to the manufacturer's specifications. Overload limits are tested and correctly set. The maximum acceptable load and the last test results are posted on the crane. Initial and annual inspections of all hoisting and rigging equipment are performed and reports are maintained. And I would maintain these reports for at least 3 years. Only properly trained and qualified operators are allowed to work with hoisting and rigging equipment. Our forklift safety guidelines. Forklift truck operators are competent and authorized by the company to operate the vehicles because they've demonstrated their safe use of the vehicles and have successfully completed an in-class, in-person training and a skills evaluation showing that they can operate the forklift safely. Again, we should never allow any employee under the age of 18 to operate a forklift. Forklifts are inspected pre-shift or pre-operation. So if your company operates 3 shifts a day, there should be 3 forklift inspections for each forklift. And things that we're inspecting include the condition of the brakes, the horn operation, steering, the forks, and the tires. Powered industrial trucks or forklifts should meet the design and construction requirements as established by the American National Standards Institute for Powered Industrial Trucks. You should obtain written approval from a forklift manufacturer if you're going to modify or add any attachments that could affect the capacity or safe operation of the vehicle. The capacity, operation, and maintenance instructions should be on plates or tags on the forklift and should indicate any modifications or additions to the vehicle. We should always be able to, those should be maintained legible, and we should always be able to read those. Battery charging the forklift should be conducted in areas that are specifically designated for that purpose. You can have a buildup of hydrogen gas if you have an area with a lot of batteries charging. So you may need to do air monitoring for that and put in some ventilation systems if you have like a battery charging room with a large amount of equipment charging at once. Material handling equipment is provided for handling batteries, and this includes conveyors, overhead hoists, and equivalent devices. Reinstalled batteries on forklifts should be properly positioned and secured to the truck. Smoking should be prohibited in battery charging areas. We always want to take precaution to prevent open flames, sparks, or electric arcs in battery charging areas. Refresher training should be provided, I would say at least annually, to forklift operators. But if an unsafe action is observed of a forklift driver operating unsafely, then we would want to have refresher training. Or if an accident were to occur, then the operator would need to participate in refresher training. Load and forks should be fully lowered, the controls neutralized, the forklift should be shut off, and the brakes set whenever a powered industrial truck is left unattended. And that is considered to be, out of a worker's sight, or they're within 25 feet away from the forklift. Additionally, we should make sure there's sufficient headroom for the forklift operator under overhead installations like lights, pipes, sprinkler systems. Overhead guards should be in place to protect the operator against falling objects. Trucks should always be operated at safe speeds. The operators should make sure they're keeping the load stable, safely arranged, and fit within the rated capacity of the truck. And any unsafe and defective trucks should be removed from service. Okay, we've got some resources that may be helpful to you as an occupational health and safety manager. Many materials can be found on OSHA's website, and you can find that at www.osha.gov. On OSHA's website, they create different publications and guides and notices that will give you a lot more in-depth information about the topics we've discussed today. Those include a guide to scaffold use in construction industries. These are like a booklet design that's in question and answer format, and it highlights a lot of information and gives a lot of good pictures about scaffold safety. There's also a publication on excavations that gives detailed explanation on all aspects of excavation and trenching. Additionally, we have one on fall protection in construction, one on excavations in particular, stairways and ladders, working safely in trenches. And some of these are shorter, like 2 pages, that look more like a poster or a handout. And those could be a great resource for you to use when you're coming up with training materials or messages to send out when you're communicating your safety strategies. It also can be useful to use these in your safety meetings. There's also a publication that's just 1 page on crane, derrick, and hoist safety with hazards and possible solutions, which would be another great reference. There's also publications on control of hazardous energy and lockout tagout. Also controlling electrical hazards. Another great resource is OSHA has a index on their website that is a full resource on the safety and health topic of lockout tagout. It has some interactive aspects to it. It has some demonstrations that you as a manager could utilize, or workers could involve themselves in a group looking at case studies. It also has standard interpretations and compliance letters and compliance assistance and training. Another website index is available for resources on hazard communication on the OSHA website. There's a publication on materials handling and storage that gives you a comprehensive look at hazards and safe work practices for material handling. Another publication on personal protective equipment discusses all the personal protective equipment we looked at today, but can give an even more in-depth look at the different protections for the head, eyes, face, torso, arms, hands, feet, and gives us equipment to protect against life-threatening hazards. There are other safety and health topics related to like health hazards like toxic metals such as cadmium that really give you great insights into the recognition, evaluation, control, and ways to be in compliance with work sites that handle and have workers interact with cadmium. And so that brings us to the end of our presentation today. I really appreciate your time and participation in our Certified Occupational Health and Safety Manager training. I really applaud you all for taking this certification course and wish you the best of luck in your endeavors in helping to increase the safety and health of the people you work with. Thank you.